Even
Hello, Siddhartha. Can you hear us?
Hi, yes, I can. Do you hear me well?
Yes, perfectly. Would you like to try to share the slide just to
Hey,
to be sure that everything works?
let me see. Do you see my screen?
Yes, perfectly. Thank you. It works. So some minutes and we will start.
Not a problem. Thank you so much. I appreciate
Thank you. Thank you. Okay, I think we can start. Are you ready? Okay, so welcome everyone for you here and also for the speakers in Zoom. I would like to start first of all to thank you all for coming again. And also, I think it's important to have a roundtable introduction to say who we are and to introduce each other. So, you know, I'm Daniela, I work in Active Citizenship Network, and I leave the floor to Christine to say 2 words about you and then to the others. Please speak in the microphone, otherwise the people connected can't hear you. Thank you.
Hello, my name is Christine. I'm from Austria. I'm working at the Lower Austria Patient and Nursing Advocacy. Yes, that's me.
Hi, another Christine from Malta Health Network from Malta. It's a voluntary organization and I'm form part of the board and on a voluntary basis.
Hello, my name is Renata Ileva. I'm from Bulgarian Association for Patients Defense. I work there for 7 years already, strongly advocate for patients' rights, and I'm very happy to meet you all here.
Just bring it quickly here. Like music chairs. So hello, my name is Andreas. I'm from Cyprus. I am the Director of Operation of the Cyprus Federation of Patient Association, which is the umbrella organization in Cyprus for all national coalition and national patient organization in Cyprus. So it's nice to be here again with you. Thank you.
My name is Vida Augustiniene. I am chair of the Council of Representatives Patients Organizations in Lithuania. We have joined 18 organizations with different diseases. I work in these organizations about 22 years already.
Hello, my name is Marta. I'm from Poland and I am project manager in the Institute of Patient Rights and Health Education.
My name is Hui Wang and I work for EU Prevent Foundation. Our foundation is actually focused on the border region between the Netherlands, Germany, and Belgium. We work very much on the health and well-being of the population living in the border region, and infectious disease control and prevention and patient empowerment are very much the focus of our work. That's why I'm here today.
Hello, I'm Jasna Karadzic-Zanetti. I'm head of Health Diplomacy Unit in Brussels and locally president of the Croatian Association for the Patient Rights.
Hello, my name is Jordan Hodges. I'm here with my team from Stripe Health. We're actually a communications agency, so we will be helping you co-create the next wave of the vaccination campaign, and we'll be doing some photography and videography a little bit later.
I'm Sarah Carter, part of the Stripe Health team for the, can you hear me? For the vaccination campaign.
My name's Mita. I'm the head of health at Stripe. This is actually the third vaccination campaign that I've worked on, so glad to be here again. And yeah, we're looking forward to the discussion today.
It's a little closer to me. Hi, I'm Joanna Muller. I'm an account director with the lovely Stripe team over here and very much look forward to working with you today.
Hi, I'm Marlene. I am here on behalf of APEX. We are a patient organization that is active in the border region, Netherlands, Germany, Belgium, just as EU Prevent. I am also working as a project manager at EU Prevent at the same time, but I'm here as an advisor for APEX today.
Hi, good afternoon. Steve McMahon, Chairman, co-founder of the Irish Patient Association. We're primarily a cross-disease, patients' rights, patient safety advocacy body. And we are so pleased to be saying we've been, I think, working with ACN for nearly 22 years, maybe 23 even, yeah. So it's great to see it flourishing, and it's really great. I feel sorry for the people looking in, but it is nice to see people in 3D, you know, in person. And I'm delighted that I see Stripe is not the Colson brothers that I thought it might have been when I saw it first. Thanks very much.
Good afternoon, everybody. My name is Bianca, and I work together with Marianne and Daniela at ACN, but I'm based here in Brussels.
Afternoon, everyone. My name is Mariano Vot. I'm the director of Active Citizenship Network, that is the European branch of the Italian GeoCittadinanza Attiva. Thank you very much for your presence today.
Okay, I give the floor to the connected speakers. So please, Stefano, could you introduce yourself?
Hello. Good morning. I'm sorry not to be there in person. I was the former director of the Italian Center for Global Health, and now I'm teaching and lecturer in global health at different universities. And I worked a lot on vaccines in my past lives and in big pandemics too. Thank you for inviting me.
Thank you. Siddhartha Datta.
Yeah, thank you so much. It's really wonderful to see all of you on the screen though, and sorry that I couldn't be there with you there. I'm Siddhartha. I'm the regional advisor for the Vaccine Preventable Diseases and Immunization Program here in WHO Regional Office for Europe in Copenhagen. So thank you so much for inviting us.
Thank you to you. And Siv Malio Nielsen.
Hi, everyone. It's a pleasure being part of this event, also remotely. I'm currently in Tbilisi, so this is my hotel room. It's late here, so I completed all my meetings for today, but I'm happy to end my day both listening in, but also sharing a bit later on.
Thank you very much. So I would just say some words about the project about which we are here today. And as you know, it's vaccination, and this year is the 4th edition. And after those years in which we met online, we would like to be all together with you, and in particular, co-create this project with you, because as I wrote to you, vaccination this year will be made from 2 occasions to have training all together. And the idea is also to produce tools that we will use all together. The first one will be a document, a policy brief that we will discuss afterwards to use with the new European institutions to promote our voices as citizens and patient association on the topic. And the second one is a communication campaign that we will develop thanks to the Stripe teams all together, and with, if you want, with all your faces and points of view, so we can share what we would like to ask to the new European institution about what citizens want on vaccination. Today, the day will be divided in 2 main spaces. The first one is the training. So we will have these experts connected to talk about global health and the European state of the art of vaccination from the WHO point of view, and also a concrete example of a way to promote vaccination uptake with the behavioral science. And after that, we will have a coffee break. And also an open discussion after their intervention, so you can ask questions and we can discuss about the presentations. After the coffee break, we will have the part in which we would like to discuss and co-create with you. So I will introduce the policy brief and that I sent to you before to arrive, and to gather from you some insight about that. And then Stripe will help us to start to create and recording the campaign. So it's a more active session afterward. And at the end, we will discuss the next step and the tomorrow meeting. So this is the overview. So I'll give the floor to Mariano for a brief introduction.
Thank you, Daniela. But probably as our friend and colleagues from Romania, Sorin, join us, if Sorin, you want just to briefly introduce yourself, thanks. We already done our introduction, so that is.
Hello, I'm Sorin Grădinaru from Romania, and I represent first COPAC, what is the Coalition of Organization for Chronic Disease in Romania, patients with chronic disease. And in the same time, I'm the Vice President for Association for Children with Congenital Heart Disease. Our association is part of COPAC, and here I'm represent both of them. Hello.
Thank you so much, Sorin. We have also received apologize for other three association participant from Greek, Belgium, and another from Croatia that for some reason they could join, and we have received their apologize. So again, good afternoon, welcome to everyone. It's always really a pleasure to meet in this close meeting, which are necessary to discuss topic of particular importance to us. I hope you all had a pleasant journey. Today, I see familiar faces, representative of associations that have been linked to our network for many years, but also new faces. So let me take a moment to introduce my organization. So together with Daniele and Bianca, I work for an NGO that is very committed to health issues. The name is Cittadinanza Attiva, founded in Italy in 1978, when the national health system, with a specific law, was put in place in my country, dividing role and responsibility between the national government and the 20 regions in which my organization is divided. Citizens decide to organize themselves to reduce health inequalities. As Italian citizens on paper, we all have the same rights, but depending on where we live, in the north, the center, in the south, we can face with different quality standard, different access to care, different number of health workers or facilities, hospital, etc. This is the cornerstone of my organization, which does not focus on a specific disease or health condition, but on the need to strengthen and protect the right of all citizens, start with those of patients. As head of European Affairs of Cittadinanza Attiva and director of our European branch called Active Citizenship Network, together with my team, partially here based in Brussels and partially now headquartered in Rome, we are engaged before the relevant institutions and the stakeholders at European level to increase the promotion of civic activism and participation in political arena, and to better protect the right of citizens and patients, which are the characteristic, the uniqueness of ACN. The organization we work for is founded on the following 6 principles: participation, equality, dialogue, transparency, acceptance, and the centrality of the person. And I hope that at the end of this 2 days event, you will have felt our effort to put these values into practice. Why we are here today? Today's initiative, as you know, is addressed to all of us as a representative and leader of a civic organization, patient advocacy groups, working at local, national level to protect the patient's right. Today's meeting is part of the activities carried out in the framework of the already mentioned project Vaccine Action 2024 that is promoted by my organization and supported for the 4th year in a row by GSK, MSD, Pfizer, and Sanofi, 4 companies that I want to thank for their continued trust. Let me also thank today's 2 media partners, Vaccine Today and the Trend Sanità Policy and Procurement in Healthcare. What we are talking today, the World Health Organization and the expert can confirm that has emphasized the importance of rebuilding trust in institutions, in leadership and science, addressing the crisis of confidence that emerged during the pandemic. Thanks to the independent expert, whom I would like to thank in advance, a common set of up-to-date information will be provided today. The choice of topic is linked also to the recent Council conclusion. In particular, ACN welcomes the adoption in January of the Council conclusion European Global Health Strategy, Better Health for All in a Changing World, reaffirming the leading role of the European Union and its member state in promoting global health, which must remain at the top of the international agenda. The 3 complementary priorities of the European Global Health Strategy should guide the following effort: improving the health and well-being of people throughout their lives, strengthen health system and promote universal health coverage, prevent and combat health threats, including pandemic, by applying an One Health approach. So we started with a question. What is the importance? What is the role of the immunization in global health? What role do immunization policy play in global health? This is an increasing topic because that is also in light of what we are reading these days at European level. For instance, it was just a few days ago, the news that the ERA, the European Commission Health Emergency Preparedness and Response Authority, signed a contract for the supply of a lot of doses of vaccine for human use against the transmission of avian influenza. And for other end, as we are approaching the trip season, we can say we listen about some cases of dengue in my country, more than 200 from January to June, but more 4 million in Brazil. Are there precautions to follow, prevention measures to take in mind? To find more, we invited an expert of the subject, a friend of my organization, who recently helped us to write the Civic Charter of Global Health, 13 rights and 60 actions to promote global health from a civic perspective. Certainly, when it comes to global health, it is necessary for the European institutions, as stated in the Council conclusion, to strengthen multilateral cooperation with the WHO. In this regard, today we have also the pleasure of having 2 representatives of WHO, whom we have asked to illustrate to us a new topic that is still little debated, but which we believe should be known especially by those who, like us, promote vaccination policy with conviction through concrete actions aimed at changing policies. Throughout Europe, thanks to a European funded project, we have already experienced the application of behavioral science in other fields of action. And we are interested in extending the so-called nudging methodology to vaccination policy as well. As always, we ask you to make the most of this opportunity by interacting and not hesitating to ask questions. We need to feel comfortable this afternoon, and if you have any special needs, please don't hesitate to let us know. We look forward to learning more because, as always, being well informed and up to date is often the best prerequisite, the precondition for promoting greater activism. Thank you again for your participation, and of course, I wish to all of us a fruitful meeting. Thank you, Danielle. Again, the floor is yours.
Yes, thank you, Mariano, and I'm glad to give the floor to the Professor Stefano Vella on the importance of immunization in global health. Please, Stefano, the floor is yours.
Yes, thank you very much again. What I will cover in my talk is mainly the impact of vaccination. Again, try to fight this vaccine hesitancy and make understandable what vaccines have done for our lives. Shall I share my slides?
If you want, yes. If you prefer, we can share them.
Whatever you prefer.
If you can, it's
no,
easier.
I have it. I have it here. Okay, that's it. So I'll share my screen. Good. You are screen sharing. Good. And I will try to put it in what is called in presentation mode. It doesn't work always very well with Zoom or other things.
Yes,
but anyway,
now it's
that's
perfect.
it.
Yeah,
It's perfect. Good. I'm very glad. And my talk will be on this, on the importance of immunization in global health, but not only. First of all, I will start by just showing this amazing figure, which is the dramatic increase in life expectancy in all the continents, actually. Let me say that it started at the end of the 18th century. Before that, we were all living around 35 years. So that's very important. And why this happened? It happened for different reasons. And again, this is another explanation that starting from Lucy, our progenitor, 3 million years ago, we gained 55 years from the 17th century. And how it happened. Of course, the reasons are different, are mainly, you see the difference in terms of disease patterns from the past to today. Of course, what disappears are mainly infectious diseases, but this incredible rise in life expectancy is due mainly to the social determinants that, of course, helped humankind. Safer food, better housing, so the usual social determinants. But of course, vaccines had an incredible role in this increase. Look at, this is in Italian, unfortunately, but those are diseases that if you look at the numbers during the 20th century until 2011, look at the decrease in percentage of these sometimes deadly infectious diseases, including smallpox, which is now at 0, which is one of the most exciting progress in the history of medicine, I think. And this is the same as a US slide showing the impact of the introduction of diphtheria, polio, measles vaccination in the number, in the prevalence and incidence of diseases in kids. And now we have today, but more is coming, at least 27 vaccines. And you see, this is the history of their development. You know, we went from the initial ones until actually the new RNA vaccines. But look at how many vaccines have been produced. And of course, they have different, not all the vaccines are the same. So we have the subunit vaccines, we have the live attenuated vaccines, the whole virus vaccines. So I don't want to be boring, but of course there are many different vaccines, and as you know, but all did very well their job. And of course, there has been an incredible evolution of vaccinology. At the beginning, we had empirical approaches, vaccines derived directly from pathogens. So this is exactly what happened with smallpox, in a sense, where Jenner injected actually the cowpox, a live virus that actually is able to protect from smallpox. You know that very well. And today we have a next generation vaccinology. They call it structural vaccinologies, synthetic biology, vaccines with viral vectors that actually we use also for COVID, but not only, we'll see. We now have improved adjuvants. So there's been an incredible advancement in vaccinology. And let me give you just a few examples. For example, the pneumococcal vaccines. Now we have polysaccharide. At the beginning, they were all vaccines which included pieces of the different strains of pneumococcal. Today, we have conjugated pneumococcal vaccines that are under development, and this is what we use today with almost 20 different subtypes. So they cover almost all the circulating bugs. And for example, another advancement is the herpes zoster vaccine. We started with a live attenuated. Now we have a recombinant vaccine, which is, in a sense, safer, supposed to be safer and more active. And then the respiratory syncytial vaccines. You know, respiratory syncytial is a disease that affects kids, mainly premature ones, but only elderly. The elderly is subject to respiratory syncytial viral infections, and they can be deadly also for the kids. And to combat this, we have a vaccine that actually can also be given to the mothers while they are pregnant. So they produce antibodies that then they can transfer to the kid during gestation and through the milk. So it's an incredible evolution, but we also have monoclonal antibodies now that can be given to, so in a sense, it's a passive immunization that we can use to fight respiratory syncytial viruses. But let me go back a little bit. Remember the smallpox. I'm saying remember the smallpox because it's no longer here. And it died around 1979 after an immense campaign of vaccination through the World Health Organization. And this is the death certificate on the right, signed by doctors, scientists from all over the world. And the polio, you remember polio was a terrible disease. I had kids during when I was at school that already had polio, and polio, thanks to these two guys, the Salk and Sabin scientists, we have a couple of vaccines that indeed make polio less dramatic today, although we have some peaks, still some peaks, particularly in the war zones. Let me say that wars are often followed by epidemics. And we are quite near the polio eradication, but we are not there yet. We are not there yet. Again, we had, for example, polio outbreaks in Ukraine because of the low level of vaccination. And then let me remember something that you know very well, the Spanish pandemic, how fast this pandemic traveled the world, despite the fact that there were no flights like today at that time. But it's important again, as I said, one of the reasons for the millions of deaths and for the spread of the flu around the world was actually the war. So we had 100 million deaths. And remember that at that time, the total population of the world was 2 billion. And today we are around 8 billion. So 100 million over 2 billion is a catastrophe. And we also had a lot of other pandemics, influenza pandemics that were not so deadly. We were pretty much afraid when H1N1, which is the strain that caused the Spanish flu, reappeared. But then a vaccine was actually produced. But the problem of influenza, you know, is that it has a tremendous ability to mutate. So we need to update the vaccine every year with the new strains. We are working on the what is called a universal flu vaccine that could cover epitopes that are likely more stable. And this is the priority list of WHO for the flu vaccine. And look, it's interesting. Pregnant women is the highest priority group, together with healthcare workers and children and the elderly, of course. So that's very, very important because, you know, policymakers should know this very well. And then I'm very quickly going to over other things. Malaria, for example, you know that we have now a couple of vaccines that are not 100% effective, but they work on kids. That actually kids are those that die for malaria mainly. Tuberculosis, unfortunately, tuberculosis is a pandemic, is everywhere, is endemic everywhere, and we used a 100-years-old vaccine since until recently. Now we are producing the new tuberculosis vaccine. It's not easy because, you know, the tuberculosis is an intracellular bug. And then Ebola. Ebola is an example of what I'm working now is the spillovers. So Ebola is a spillover from a bat virus. Of course, we still have a lot of little epidemics of Ebola. It never became a pandemic because Ebola virus is too deadly. So it couldn't, you know, expand the transmission too much, but it's still there. And fortunately, here we did, again, they did a vaccine in a couple of years. So it's again very important to say that it's not true that only for COVID we had a vaccine in just a year. They produce vaccines against Ebola that work. And again, this is, for example, a viral vectored vaccine, so a new way of administration. What I need to say, because it's a problem of global health, is that vaccine availability and coverage. This is the coverage for DTP, so the basic vaccine for kids. And there are countries in Africa, for example, where the coverage is extremely low. And when I have to explain to my students, but also to the general public, what's the meaning of a vaccine? Look at the areas of the world where the measles vaccine is very low, the coverage, and look at the death. The death for measles are exactly superimposable with the lack of access to this vaccine. So this is a proof that cannot be counteracted. COVID is, again, you know that, you have been involved with all the issues of the different vaccines that we had for coronaviruses. And it's true that we had a vaccine in a year, but like Fauci, as Fauci said in 2021, it's not true that it took just 1 year to do this vaccine. There were 10 years of research before. So that's something that, you know, the people that the Novax say, hey, you just invented COVID and vaccines in a year, but it's not true. We had the necessity to study RNA vaccines for decades. And now we know that there is an evolution of vaccine production. So at the beginning, we started with analog vaccines. We were growing the bugs, purifying them and injecting them. Now we have digital vaccines. And so the important thing is to have the sequence of the bug. And with a sequence that can be distributed over the internet, it's possible to do mRNA vaccines, but not only RNA vaccines. So that's the new generation, is the digital era of vaccination. And actually, this was also followed by a regulatory change. We were talking about EMA. In fact, this is the usual phases of vaccine development. For COVID, EMA and also FDA did an effort to speed up the phases of clinical trials, and also they did a kind of what is called a rolling review. So it's important that instead of having the full package to see that there are billions of pages, thousands of pages, they look at data whenever they come available. So it's also not only a scientific advancement, there's also a regulatory advancement. And I don't need to tell you that the vaccines indeed protect from death, protected a lot of people from death. Of course, not all, but vaccines, unfortunately, one of the mistakes we did, maybe we said that if you are vaccinated against SARS-CoV-2, you don't get it. But it's not true. Not all the vaccines protect from infection. They protect from disease, which is a different thing. And of course, even here, look at these data from the New England said how much the vaccines were effective. I'm stopping here by saying the big problem, because you are all advocate for equity, and COVID-19 has been an example of inequality in vaccine coverage. Look at, so the rich part of the world bought and produced the majority of vaccines for themselves, and only a few vaccines were given to the low middle income countries. So that's something that we need to avoid for the future. I hope it will happen, but that's in a sense a great and not honorable thing we did. And finally, there's been a very nice paper, Vaccines for a Sustainable Planet, where this paper says how much vaccine can influence all the Sustainable Development Goals. You know that the Sustainable Development Goals are not to be taken alone, but vaccination can have an incredible impact in all the SDGs, not only on SDG 3, which is the health SDG. So I'll stop here. These are my mails, and I'm ready to answer your questions. Thank you very much.
Thank you very much to you. And yes, please, if someone has some questions, this is the time to ask. Doubt, questions, curiosities. Yes, Stephen, please.
Thank you very much. Thank you very much for the presentation. It certainly gets the mind thinking. Just one quick thought comes to mind, and I think it comes to, from the point of view of messaging to the wider society, that in the wealthy countries, the wealthier parts of the world, we can afford the vaccinations, but for the low-income countries, we can't. And in a way that they are the cookers of continuum of the various viruses, that if we dip our immunization rates, we are becoming exposed. But my real question is, how can we look on it as a whole of world issue as opposed to high income versus low income? Have you any thoughts on that?
No, I think that this problem of inequality is actually, it's a problem for and this is why we call global health, because health is, there is no health if not everyone is safe. Let's say we learned this from the COVID. And of course, there are a lot of organizations like Gavi and others that distribute vaccines to the poor countries, but it's not enough. What we are working, I work now for the G20. I also work a little bit for the G7 on global health. And one of the possibilities to produce local manufacturing in the countries. Now, in all the declarations, you will see also in the G20 declaration, but also in the G7 declaration, this part is covered, that we need to produce, to have local production. We need to stop with donation. Donation worked for a while. We need to stop. Health is a right, and we need to have this health products produced locally. I'm not saying only the vaccines, but also antibiotics and other drugs.
Anyone else? No? Okay, so thank you very much again to Stefano Vella. And
it's been a pleasure.
I give the floor to Siddhartha Sankar-Datta for a presentation on vaccination policy in the European region. Please, the floor is yours.
Thank you, Daniela. Thank you so much. Thanks to Professor Vella for outlining the benefits and the impact of vaccination. So I will start maybe from there. Let me see if I can share my screen with you all. If you can tell me whether you can see my screen in full.
Yes, now we can see it.
Right, okay. Thank you so much. So one other thing which we thought that you outlined at the start, Daniela, about the new vaccine action in the European region, as part of your new vaccine action, I think there are a couple of things you and your colleagues may wish to keep in mind. One is that this vaccine action, I think, comes in a very prudent time. This year, 2024, is the 50th year, 50 years of the establishment of the expanded program on immunization. In 1974, WHO, together with its member states, 194 member states, came together to put in what we say expanded program of immunization, wherein any child born anywhere in the globe would be provided the benefits of the vaccines. Obviously, at that point, as you saw one of the slides of Stefano, that we had only 6 vaccines on the horizon. And today we have 16 plus, and obviously the count goes higher. So that was a time when we talked about equality and equity in the vaccination access. The vaccination coverage in 1974 in the European region, and in before that, it doesn't mean that there was no vaccine given in the European region before 1974. It was there, but not everyone born in the region was getting the vaccines, because the vaccines was not part of the national immunization program, or it was only the product to be addressed by a part of the population and not everybody. So the vaccination coverage at that point of time in 1974 was around 5 to 9%. That's where it varied. That means only 1 in 10 children born in the European region were getting the vaccine. In 2023, if we look into that coverage, we are around 95%. And obviously, there are covered few countries much lower than that, but at an average in the European region, we have 95%. That means around 9 out of 10 are getting these vaccines. So you can see how the immunization program has expanded from just 1 in 10 to almost 9 in 10. But one thing is critical, and that is where I would start my presentation, telling that vaccines doesn't become vaccination by itself. There is a process that needs to follow, and there are 2 elements that I want to bring in here is vaccine systems or immunization system and vaccination strategies. Obviously, we were a childhood vaccine at that point of time. It was given only to children. Now we have moved from children to adolescent to the cervical cancer HPV vaccines, and then into the elderly population group with the influenza vaccines and the COVID-19 vaccines, as you have heard from Stefano earlier. So, wanted to outline this one for you. It looks very complicated, and I want to underline to you that when we talk about immunization, it is not a linear journey. And making a decision-making process in immunization program, there are so many different determinants. And this was presented in 2017 by UNICEF at the Global Strategic Advisory Group of Experts meeting in Geneva. I think this captures not all, but fairly good number of determinants that that an individual, that a family, that a community makes when it comes for immunization program. But for an individual or a family or a community to make a decision, there are different systems that also play a big role. The health system in general, the immunization systems in particular, and also the political decision-making process. So each part of this diagram or each component of this diagram has got its own significance when we talk about why a person is not coming or why a health system is not being able to deliver the benefits of the vaccines. We all know vaccine is an investment. It's not a cost. But when we know that $1 invested in the vaccination program can give you $44 back, we need to understand why that most cost-effective intervention of public health is not being able to reach everyone and everywhere. So I think this is a good thing that we all outline, discuss what amongst this is missing in each of the country settings that we talk about. In the middle, this is a congruence of all these that come together, and that is where we feel immunization, being a person-centric public health intervention, has got its own value. When we talk about immunization system, this is also for us to remember that a vaccine service delivery can only happen when we have a resilient immunization system. On the left, we have these WHO's health system building blocks, and each of these are all health system building blocks, but each of these components have got a much bigger, or if not much bigger, but at least they have their own significance in running an immunization system. Whether you talk about governance model, or whether you talk about information system, or healthcare financing, or human resources, or service delivery, each one have got its own significance. I'm not going to talk about the people, which is in the middle. As if my colleague will be talking about vaccine acceptance, which is critical, but I just wanted to outline that when we talk about immunization program and its acceptance, we quickly jump into and run into vaccine hesitancy or people's demand and acceptance. But please remember that this is only one part of the entire immunization system delivery that we talk about. On the right is that what are those which constitutes an immunization system? It can be at the national level, subnational level, at the primary health care. Each one has to work in tandem. It's not that if we want to improve vaccination coverage, we can pick and choose as per our convenience to fix the system. And that is what we have been telling to our member states, that we need to have a holistic view in how a system works and how you can make your vaccine service delivery robust. Another way of looking into it, we know that there are vaccines which are manufactured. They need to come in a potent state so that the vaccines can be given to a last beneficiary, last end of the beneficiary system. But sometimes this needs huge amount of planning, huge amount of distribution network. For this one, it's not about having a van which can go from the center at the national capital airport to the healthcare center. We need appropriate legislation to ensure that this legislation acts as a driver for uptake. And I think this is critically important, that again, coming back to understanding holistically, what does that mean to make these vaccines to vaccination? COVID-19 was a great example. We know, yes, higher income countries got the vaccines first, but this did not mean that higher income countries had a very high coverage. Higher income countries also have struggled, because to give a vaccine to the young child and the mother, we knew how to do it, but we did not know how to reach out to my 80-year-old father who is in a nursing home or a care home. So having a vaccines to the vaccination requires appropriate legislations to be put in place. The health workforce need to be trained so that they can provide the services which are needed by the community. And this is where, again, coming back to one of the critical elements of vaccination program is a broad engagement across stakeholders. You sitting in this room have an immense role to play, because you are the citizens' voice, but you are also the linkages with this governance in a country. The ministries of health, the finance, the partner agencies who are in the country, but also providing that ground level information to the decision makers at the national level, what would work and what would not work in a country. But remember, let us also try to see how we can bring some good practices, but also some failures from the field up to the national level. So I think we all have a great role to play in this process. One thing which we have learned in the European region is that to ensure a high uptake, it would need a multi-pronged tailored intervention. What has happened, or what has been successful in the UK, will not work in Italy. May work, but it is not no guarantee that a copy-paste mechanisms would work. What has happened or has worked out in Italy or in Rome may not work in Vicenza. So I think that is what we are learning more and more in our region. That's what we are telling, that has to be a tailored intervention based on insights you will hear from SIF, and then it needs a multi-prong. And so each and every component of this vaccination journey need to be addressed. And that's what I said earlier. We just cannot pick and choose based on our own convenience to make sure that the system works. Let me end my short presentation with this slide. Obviously, European Immunization Agenda 2030 outlines all of these key pillars. This Agenda 2030 is a political commitment, which is extremely important for any program to function and flourish. The Agenda 2030 was adopted by all our 53 member states in 2021, and it has got three important pillars: addressing equity in immunization, addressing immunization across life course. Obviously, that is what we are graduating from, a childhood vaccines. But the most important element is to make it happen is to find local solutions to local challenges. And I think these are the three key pillars for this Agenda 2030. Within that, we feel that the local ownership will be key. The local governors, the municipality mayors, the teachers in the local area, you all as as a local advocates in the country and also subnational level. But the important element is at the national level, the subnational policies has to be data enabled. It's not like I feel and hence a program needs to be done. What is the data telling us where the money needs to be invested? And I think this is critically important. The other part of this Agenda 2030 is the accountability framework. WHO is working now with member states and also the partner agencies to put together and implement this accountability framework. There has to be transparency in monitoring and evaluation, but there also has to be action-oriented accountability around the implementation or lack of implementation of this Agenda 2030. So on that note, let me pause here and either Daniela, whether we want to take some questions now or after Sip's presentation is also fine to me. Thank you so much, and I'll pass the floor over to you.
Thank you very much. Yes, we can have questions right now, if any. Yes.
Sorry, thank you. Just one question. It comes from your chart on the resilient immunization system, the robust vaccination service delivery. And at the very end there, it has demand generation from advocacy and communication and community engagement. And it's just that I don't get a sense that there's a recognition for the importance of engagement of civil society, of patient advocates in actually the whole process, that it's not just there, like as our organization in Ireland, we've done a huge amount of work in advertising, or not advertising, promoting the whole concept of flu immunization for children. But it's really part of the whole process, as opposed to at the last minute, oh yes, we've got all these vaccines, now we'll depend on civil society to help us get everybody to take them. I'm being a bit crude there, but I hope you get the idea. Thanks.
No, this is a very pertinent point, and thanks for raising it. Daniela, is that okay that I answer, or we wait for someone?
Yes, absolutely, please.
Okay. No, thank you so much. And I think you will hear more details from Saif, obviously, about what is our vision around it, how do we see that process. I did not go into that detail, but I cannot agree with you more that the promotion of vaccination or communication campaigns, including engagement of the local level functionaries, should not be the last minute addendum note. It has to be what we are telling to our member states, that this whole process of planning and engagement with the local level functionaries like you all and others should be done at the start. It should not come at the fag end of the implementation when we run into a problem. So this is one. Number two is there has to be some course correction during the process. The member states can come out with a draft policy, which is absolutely fine, consultative process, and every stakeholders need to be part of the consultative process. But during the implementation pathway, then there should be an opportunity for course correction for everybody. There are mechanisms in the country, and I hear, I mean, the countries that are represented in that room, we have national immunization technical advisory groups in each of your countries who are represented in that room. There are stakeholders engagement within that technical advisory group. There are health coordination clusters in the countries where each one of you can get engaged with, where you can bring your local voices into it. And I think the more voices we bring onto the table, the more robust the program would be. The other part I would also want to bring it here, and that is what I was telling, that lessons learned from the field need to go up to the national level. There should be a mechanism where we can see what is working and not working in the field, and those things can come as part of the partnership model that this Agenda 2030 outlines. Within the consultative process of the European Immunization Agenda 2030, we brought 44 organizations together for a dialogue. If you ask me, did we, not I, did we reach out to any one of you? I'm not positive on that. So we need to also acknowledge that we may not know everybody else who is there in the horizon who is working on it. So we are very much keen, WHO is very much keen to see that we engage like this, what we are doing today with you and others. And I think this whole mechanism, the partnership grows. And the local solutions to the local challenges cannot happen from Copenhagen, cannot happen from Rome, the national capital, or any other national capitals, cannot happen from France, from Paris in France. So I think we need to bring this local context more and more aligned so that if immunization need to succeed in the future. So I know that I may not have given you a direct answer, but I hope I could provide you some outline of what the plan is, or at least the ideas are at our end in WHO. But thank you so much for allowing me.
So thank you. Any other comment? No? Okay, so thank you very much again. And please, Siv Nielsen, about using behavioral insight to increase vaccine uptake. The floor is yours.
Thanks so much. And yeah, I think I didn't actually get the chance to mention that I'm a technical officer at the regional office in Copenhagen, part of Siddhartha's team, focusing on vaccine acceptance and demand. So my majority of work is actually supporting country with developing tailored interventions, both for routine immunization, but also for new vaccine introduction. Let me see if my slide is... Okay. So this is a bit of a repetition from the two presenters that we just heard. We actually do still have some coverage gaps in the European region. Vaccination has been a great success, still is a great success, and we know that's one of the major drivers in having prevented billions of deaths due to infectious diseases. But unfortunately, we still have issues. We have also seen some backsliding. And as Siddhartha mentioned, the majority of these reasons is not to be able to find sort of one size fits all. We really need to look into what's the issues at country level, but also at regional and sub-regional and even district level. In some countries, we can even go, further down to the level at poly-level clinic to figure out what is the issue for a low vaccine uptake, or that could indicate a gap in the system. So what are the chance observations that we have seen so far? Vaccination covers, it does differ across countries. We know that, but also within the country, as I just mentioned, but also among different population groups. And that literally go back to the fact that we cannot just develop one intervention and be sure that that intervention will work for all. We know that the barriers and drivers are different, they're unique, but we also know that vaccination resistance can be influenced by multiple factors. So it's actually quite complex, but we have to look at the broader picture to be able to make a difference. We also know that, as Siddhartha mentioned, what might have worked in the UK or any other countries, we cannot just take that and sort of duplicate the interventions or sort of their processes or their campaigns, because it might not work in a different context. Some interventions we know work at a national level and others don't work at a subnational level. So we need to come up with a targeted approach to be able to increase vaccine uptake that do actually fit into the tailored interventions to the need of the locations, but also to the need of the population groups. So that would then lead me to the next slide here. And that's why we have to listen. We have to understand. And based on that, then we can react and we can develop the tailored interventions. So behavioral insights to address barriers to vaccination. We do that by having a research approach to identify human behaviors, behaviors that influence vaccine uptake from the perspective of those involved in the vaccine. So that could be me as a caregiver. What does influence me in regards to taking my children for vaccination? Or it could be healthcare workers. What does influence him or her in regards to recommending the vaccine to his and her patients? These things we need to understand. You can get that insight by asking questions through qualitative methods. You get the perspective and the experience and the attitude of either caregivers or healthcare workers, or there could be anyone else that could be involved in a vaccination process. And the purpose of conducting these very, sort of zoomed in and target behavioral insights intervention is to understand the barriers to vaccination, so that can inform the development of the interventions. There's been mentioned a lot about communication campaigns, and I think we come to a stage that we know sort of a broad communication campaign does not fix the entire problem. It can have a positive influence, but we need to look at a broader pictures, and that needs to be combined with any other vaccination, also through community engagement. So this is just an overview of the member states in our region that we have supported in conducting behavior insights research. So from 2020, you can see it peaked during the COVID pandemic, where country realized that we need to understand the perspective of the population for us to be able to increase the vaccine uptake. And that needs to be done during the pandemic. So we developed a rapid insights research approach where we could actually get this insight within a shorter time frame than normal. And since then, we can see an increased appetite among member states in conducting similar insights, but now for routine immunization. So really understand, why do we see an increase or drop in vaccine coverage? So this is actually just an overview of the factors that influence a decision-making process or vaccination behavior, post-vaccination behavior, as we can say. So it consists of these three factors. We call them COM-B. So the one is above one, the light blue one is capability, which is actually level of knowledge and health literacy on immunization vaccination. So what do you as a person know about vaccine? How do you understand it? It's also opportunity, which is the support from social networks. So we call it a social opportunity, but we also call it physical opportunity. That's the two squared boxes below. And we know that also you're influenced by your neighbors, young people or younger generation are very much influenced by social media. We call them social influencers. It could also be that you are very influenced by your GPs, what him or her recommends, or if you're in a religious community or a smaller community, that could be the community leader or religious leaders. That also have an effect on whether you decide to take your child for vaccination or not, or whether you want to get the vaccine yourself. And then we have the convenient access, which is much more of the programmatic issues that Siddhartha mentioned, that we cannot just look at one side of it. Is the vaccine at all available? If it's not, of course, then that has an influence. Is it easy accessible? Is the waiting hours convenient for you? How is the healthcare facility? Do you feel comfortable going there with your children? Is there a long line? So all these things we also have to consider when we develop interventions, because imagine if we come up with a very nice and neat communication campaign, but actually the issue is much more of the convenience level, that the opening hours doesn't fit within my work calendar. Then I might be convinced that vaccination is a great idea, but that doesn't make me go to the healthcare clinic because I'm hindered otherwise. And of course, that's very, at a personal level. And then the motivation factor, which is the light gray one in the middle, that's sort of my personal attitudes and intention. I weigh, so what is the benefit of the vaccine? What's the downsides? And then in combination, all of this, then you go for vaccines. And when you sort of, through this insights research, you get an understanding of these drivers. You get an understanding of the population's knowledge, the attitudes and intentions, what influence them. Is there a specific person, or is it that one that lives in the community that sort of have an influence, or is it a famous person, or who else? That you would think you know, why do we need to get that information? I mean, it's nothing sort of, it's not rocket science, basically. I think we can all be familiar with this for any other sort of health intervention. What motivates me to go for a run? Why do I eat healthy? Or why have I chosen to become vegetarian? It's really nothing different from the fact that there's many, many components that does sort of play together. So I just want to say that when you have these sort of, you know, very detailed information, you have to come up with very detailed interventions. So you cannot just take that and then say, let's create an overall communication campaign and then we fix the problem. Not at all. We really have to do the local interventions, as Siddhartha mentioned. And I just want to give you an example of some insights research we did in Azerbaijan, where they had seen a low coverage within the MMR, the first vaccine. And they had even specific districts area. So we could go in and we could do the assessment or conduct the insights research to understand the barriers and drivers, in particularly among healthcare workers for recommendation, but also for caregivers for taking their children for vaccines. And we did realize there are some gaps in knowledge. There are some misinformation still floating, so that we have to work on. There's lack of guidance about the vaccine in general, basic information. There were still some concerns about the vaccine causing side effects that we see quite often as a result of conducting insights research. The populations want to know much more. They want to be reassured about side effects and AFIs. And we realized that doctors in particular in this district have a crucial, important role in building vaccine confidence. So among the population, among the caregivers that was interviewed or we asked, they all share that healthcare workers, they are the trusted source. So that, of course, lead into how do we then develop the interventions based on all this insights research. And we also realized that the last one was the structural one, an access barrier. You saw some access barriers in rural locations. There is less healthcare workers available, and that the budget for outreach was not in place. So basically what they came up with is that, first of all, we need to use the healthcare workers to deliver information to caregivers. We need to go into the communities where those people that do not have the needed access, to convince them and to be open and transparent. The healthcare workers that we want to involve, we also want to make sure that they are well trained. We want to be sure that they have the most recent updated information about vaccine safety, because that was what was the concern among the population group. So you can see it's very much, you know, how to say, multiple factors that need to play together. Also, because we're talking about smaller communities, we knew that the community leaders had to be engaged also and has to be in part of the event, you know, saying that I support this event in general. And of course, when you go into a community and you share information, you need to have the information available. You need to be able to hand something out. And they organized all this in these areas where we knew there is low vaccine uptake. And you can see within one day, and they did this in the 4 regions where there was low uptake. They did it during the World Immunization Week. They actually managed to vaccinate 335 children that day. And 80% of those were those that have been unvaccinated. So I think that shows how effective, if you really are able to zoom in and tailor, if you develop the intervention accordingly to the population's need. So this is slightly different because this is preparing for HPV introduction in Kosovo, meaning that you don't have, you know, the direct sort of insights because it's not yet been implemented, but still you can go in, you can get a sense of, is there something that needs to be sort of tweaked or tailored, and then based on that, developed interventions. And here again, it was clear that there were knowledge gaps, misinformation, which is could be anticipated. First of all, it's a fairly new vaccine still. There's been a lot of misinformation circulating online, information travel across borders. So for sure, that's also been shown on social media in Kosovo as well. There was a lot of concerns, but still high trust in health workers and the authorities. And also smaller communities that lack access to health service, including vaccinations. So again, looking at that, interventions were developed. And we engaged those professional communities, exactly what was mentioned just before as a comment. It's extremely important to engage those NGO communities that have direct access to the population groups, that know how it works, because it cannot be done only from our end and not from national health authorities either. A lot of training was developed to equip the healthcare workers with the needed knowledge, again, if they were approached by teenage girls themselves, or even caregivers, or maybe teachers in regards to questions on vaccines. That needs to be in place. So the recent number from Kosovo, so all these interventions were sort of implemented simultaneously. So again, it's not just one intervention. There's various interventions that sort of, target each need different target groups, that they now have a 60% coverage of this cohort, which is fairly good, as this is a new vaccine introductions. And then that was all from my end. So if you have any questions, I'm happy to respond to it. Over.
Thank you very much. Any question from there? Everything clear? Mariano?
Just to know if you have implemented some case study in Europe on the behavioral insight related to vaccination. Because if I well understood, the study covered different member states, but then in the example, it was very far from Europe. So in some initiative in Europe should be interesting for my side to know. Thanks.
Yes, there has been done several, actually. One of the first sort of back in the days when we developed what we call the tailor immunization program interventions. That was pilot tested in the UK. Sweden have done a lot of work. Denmark, they did it actually during the COVID-19 pandemic. They built their entire HPV communication campaign on behavioral insight studies. Denmark, they had a crisis due to a documentary. They started with a high coverage, and then unfortunate documentary was broadcasted on national TV, only showing sort of one case of it, meaning that the coverage dropped to, I think, 14% at some point, but not, but they had to do everything from scratch. Behavioral insights, qualitative behavioral insights approach was one of them. They also did various other things, as Siddhartha has mentioned. They looked into the program, how do they deliver the vaccine? They involved stakeholders. But the behavioral insight study was mainly done to be able to how to reach and approach caregivers that do have this concern. And that changed everything. So basically that intervention they did, I think they used the same sort of slogan as other countries called Stop HPV. The website and everything about it doesn't exist anymore because now HPV has become part of routine immunization in Denmark. So they don't do any particular now for promoting it, but they did it to sort of make sure to have a high coverage again. Still, there's gaps actually among boys, for instance, in Denmark, and they have done the same. So they have done behavioral insights research to figure out what is sort of the issues for boys not to come in, and they've done various interventions with now introducing the vaccine at schools, which is much easier, and so on and so forth. So we have various European member states that have done this insights research. The Netherlands have done as well. They do it quite independently. So it's not always from our support, but they use our approach and materials.
Thank you. We did research last October into attitudes of the public to immunizations for children, which is free in Ireland. I'm sure it is in other countries. And we found that 4 in 10 of the population were hesitant to have their children vaccinated with the flu, even though it's free. And of that, interestingly, 49% were women and about 38% were men that had that view about the having their kids vaccinated. And again, we found that there were those regional issues that was discussed earlier between different parts of the country. And Ireland is not a very big country. So we actually had those differences there. And we tried to tailor our messages in what we did to try and sort of counter that. But one of the things I think the health system did, I think, which is really important, is that now that they're beginning to move the flu immunizations into the schools.
Yeah.
So you don't have this gap between somebody, will I go to my GP or my pharmacy? You get it done in pharmacies now and all that. So I think that we've got to be mindful that, you know, in certain, say, moderate, higher income countries and so on, the working practices are totally different to other areas, and we have to be mindful to facilitate that, you know. So thought I'd just mention that.
Very good point. I totally agree.
Okay, any other comments? Not from now. So I just would like to thank you, all the speakers again, and say that all the presentations will be available for you, so we can use them as a very important inspiration also for the work that we would like to do on the policy brief and also with the communication campaign, because we have a lot of very important insight and suggestions. So thank you very much. And now for the people in the room, we can have a little break, coffee break, and then continue with the second session. So thank you very much.
Thank you to you. It was great.
Bye.
Bye.
Thanks a lot. Enjoy the rest of the event. Bye.
Thank you.
We have 4:30.
Downstairs.
Okay, so the coffee break is downstairs. We
No, where we have lunch.
okay, where we were lunch, and at the beginning we say to start again at 4:30, but maybe we can remain in. Okay, so 4:30 here again.
Okay.
I don't know. Are you ready? Coffee works. Not, you're not sure. Okay. So, but now you have to be active and reactive. Okay, because we would like to start talking about the policy brief document that I sent to you in draft some days ago, because this is, as I said at the beginning, is one of the tools or products that we would like to produce with you and all together and to use it. So in the framework of the vaccination 2024 project. Why this policy brief? Because as I anticipated, we would like to put together some citizens' recommendation to the new institutions on immunization policy in general and the adult immunization policy, because we are working on it in particular in since the last 3 years mainly. And so gathering some of the main demands of civil society, patient association, and vulnerable target groups. What we would like to do, what we did, we all made a lot of work on this topic and produced a lot of documents. So we started by selecting the main guidelines, recommendations, and proposals that are already present in the documents and in the report of working groups that we all directly or indirectly contributed to over the past 2 years. And we so put together the main points that we think could be interesting to address and to propose. Until now, the main sources that we utilize are those one, and I put in the slides that I'll give you the links to these main sources, and of course our institutional sources, groups as the Mission Board on Vaccination, proposal as the interest group on life course immunization. Also the works made with you. As you can see, there is quite the same situation some years ago, talking about vaccination with some of you. I can see Stephen here. So those are the main sources used until now. And the recommendation that we put together are summarized here with their titles. So the first one is promoting life course immunization culture. The second one is to recognize and reinforce the involvement of civil society in adult vaccination, but in the work of vaccination in general. The importance of data and evidence for decision making. The, of course, importance of access to enhance and facilitate the access to vaccines. To advance in the vaccination equity in Europe, but not only, as we heard before from Professor Vella, and strengthening fight against dis and misinformation. And last but not least, support the effort to prevent cancer throughout vaccination. But those are only the first 8 recommendations that we put together. But as said, this is an open document that we would like to finalize with all of you, because it should be a common document, a jointly document. So we would like to hear from you to understand if there are other points, other priorities, other suggestions that you would like to include in these documents, the sources from what you would like to include suggestion in this document. And we would like to start discussing it today, but also receiving from you by 3 weeks from now written suggestions, so we can try to include them directly in the document. As you can see, today we are a lot of association, and it's beautiful to see all of you in the screen, including the people that should be with us, but for different reasons can't be here today, sorry. And this is the same thing that we would like to include in the document. So we, as patients and civic association, are asking and are recommending this to the new elected institutions. What we would like to do, as said, we would like to receive written feedback from all of you by the 12th of July, so 3 weeks to gather your insight. To gather your insight. And the idea is to have a final document with all your suggestions ready to by the end of July. And I'll send to you, don't worry. The idea is to work all together, also to add, if each one of us add another association that endorse this document, we can have a bigger and stronger document to share and to present to institution. And as said, the idea is to have this final tool to use with the meetings with the members of the European Parliament, but and in general with the EU institution, but it is a document to work on the vaccination policy in general. And so, thank you. This is the last slide. I would like to receive your first insights, and because you have read the document, do not worry. It's just a brainstorming to understand if you agreed, if you have in mind something more. Do not have fear to say something that is not useful, because everything at that point is useful to have a first exchange. This document will, and those recommendations are also important as base, as to be the base also for the communication campaign, and also for the answer to the questions that the communication agency teams will give us to record and to go ahead with the campaign. So please let us know what do you think about it, and what you think to add or to change about the document. We can do a round table, so each one of us can say something, but starting now from this other side. So Stephen, please, would you like to say something about that? Thank you in advance to all.
Thank you. Just a quick comment from that photograph of me before. I'm not wearing the same shirt. Okay. Yeah, no, I was just thinking there, and this is just straight off the hip, if you know what I mean. I think that the language of advocacy has shifted from simply saying we need a voice, you know, this is an issue, to the language of rights, because rights are recognized and respected in our own countries, and there are international agreements that support them, and that's what civil society is all about. So I think in this that I think it's important that that the document is actually identifying what this is all about from the point of view of delivering rights. So it's delivering rights in a sense of innovation. It's delivering the rights to safety. It's delivering rights to quality. And in actually putting that as the fundamental building block, that this is what we're doing. So we're reminding society that this isn't something that the school teacher is saying to you. These are your rights. This is what this is all about. And then I think from the point of view of the communication strategy, I think, yes, it's very important to connect with the European Parliament and all the various players that are in that space. But equally, it's as important to connect with the public. And that requires in our own countries, maybe perhaps doing maybe some sort of we do a template of a press release or something like that, so that the wider public is understanding of what's actually going on, that it isn't all those people out in Brussels. So they'd be just my quick thoughts off the top of my head.
Stephen, because your suggestion allowed me to remember, first of all, that Stephen worked with us in 2002 to draft what is the European Charter on Patients' Rights. He emphasized the patients' rights as a citizens, and in that document, that is one of the main milestones for the one who advocate at European level on patients' rights. Stephen, together with the other leader of several associations across Europe, was one that draft exactly this principle that should be guaranteed, implemented for everyone, everywhere across Europe. And when you talk about, for instance, what does it mean? Innovation in the context of vaccination, in your example, I have in mind what we have already listed by the expert today. When Professor Vella talked about the digital era of vaccination. So the innovation cannot be stopped also in the vaccination research and production, etc. But it's important also how to governance this kind of innovation. When we talk about some other aspect, I remember what WHO said before: vaccination is an investment, not a cost. So also this kind of principle, from my perspective, could be added in the document that we are now interested to draft. The pandemic, remember us that the expenditure for vaccination has been an investment. What does it mean is if we change this paradigm across Europe, because the health expenditure are recognized as a cost instead of investment, it could be changed a lot. Talking about vaccination today, now we are talking about this topic, but if we change room, if we talk about innovative therapies, there is the same. So it could increase the access to patients if we change the paradigm from accountable rules, if we consider some expenditure in public health as an investment, and vaccination is one of these. So also in our document, we can take inspiration from some concept that has been already said by WHO, not by myself, etc. Even there is a great consensus about the need to recognize specific health expenditure as an investment. But again, we need to convince at European level. So the document is part for this advocacy initiative to interact with the decision makers at European level. Thanks, Stephen, for your inspiration. Madam, from the Netherlands.
Yes.
Correct.
Correct. So one thing I'd like to add to the policy brief document, in the paragraph where we talk about strengthening the fight against dis and misinformation. What was missing from my perspective was that it's being talked about that training opportunities for health professionals to become more versed in techniques how to counter vaccine dis and misinformation. It's of course very important, as health professionals are also always the trusted source for people that they tend to when they have questions about vaccination. But why we are here today is also that we as citizens and also representatives of civic organizations also play an important role in fighting dis and misinformation. And therefore, I would also like to add a point of also helping us in moderating, for example, situations where people might be hesitant or even afraid of taking the vaccinations, because I have the feeling that often these discussions tend to get also a little bit emotional. There's always a lot of emotions involved. So I think for us, it also could be interesting to receive such trainings and not only focus on health professionals.
Thank you. Just another suggestion. We can probably need to do not put together the misinformation with the request of information. A lot of citizens need additional information for their legitimate doubt in approach with vaccination policy, especially for the new vaccine, etc. And what we need is probably, if I well understood, is from one hand to guarantee what, again, I have read in the slide of WHO, well-prepared healthcare workers. Because if we don't have up-to-date skill, if we don't guarantee up-to-date skill to healthcare workers that are the ones probably much more close to the citizen patients, we found trust in what they said, this could be a negative effect, etc. So we need to provide also this aspect in your suggestion, if I well understood. Okay, please.
Thank you. Just on what you're saying there about training, right? And how emotional it can be, and it can be. Is it the kind of training just knowledge about the vaccinations, or are you talking about negotiation skills, which are
exactly
negotiation
and also moderation skills? Yeah.
Please, Sorin.
And next. I think we have to use our experience as patients, and with association with a lot of patients with chronic disease, we can use these examples for convince other people how important it is to vaccinate it. Why? Because, for example, for my child, it was very difficult when he was just a boy to find some vaccine in Romania, what he needed. We fight for that vaccine because we know it's very important for him. Soon he will be grown up, and we as a parents, we know how important it is to continue to protect him, because all his life he's have a good life and make sports and everything, but in the same time he have probably need more care like other people. So even if he's a healthy person, he still need protection, because vaccine, that is what offer protection. And in the other side, the coalition of organization for patients with chronic disease have a lot of situation with patients who want to vaccinate as adults. And starting last year in Romania, we have a new scheme for vaccination, and the government pay half of the money or all the money for some vaccines. So it's a next step. And we as association, almost every time when we have a meeting, we spoke about this because we think it's very important.
Thank you, Sorin. In the relationship with the chronic condition, people with chronic condition, comorbidities, and the role of not only of the general practitioner, but the role of the specialist, we summarize this interaction with the need to each contact count. The opportunity that when we interact with our specialist, the specialist can, for instance, be have the access to our health records to remember us if we have or not already get vaccine according our condition. Not always this happens. Not always there is enough time for the specialist to be aware about this information, but this is something that is quite common for people living with comorbidities or chronicity in which the attention of the healthcare professional, the specialist, can be extremely supportive to access to vaccine. And in some cases, the vaccine is free in some time, age, for some age range, etc., etc. But it is not still or not very well known. Exactly. So thank you for
yeah, and I don't know how it's in other countries, in your countries, but in Romania it's very hard to find patients to speak about this because they speak with us, but they don't want to speak, public to make maybe an article in the newspaper or something like that. Usually they don't want to be public. They speak only with us. I don't know, maybe you have more, because if a patient speak about himself, if about his condition, it's more credible for the other to to understand his message. That's why we try to convince them.
Yes, thanks. Yes, I'm reflecting on an aspect that is linked with the healthcare professional that need to be up to date when we talk about vaccination. In the most of cases, there is each condition different, each situation is different from other, and for this reason, they don't want, in some cases, to too much generalize, etc. But again, it is important to guarantee to the healthcare workers up-to-date information, and not today, not tomorrow, but in the next weeks, our idea is to draft an open letter to the new institutions that they can guarantee to the healthcare workers upskilling, training, etc. There is the precondition, not for better protect the patient's right. Our idea is to provide to you also this very draft letter, also for your consideration, for your endorsement, etc. We need to have a positive dialogue, to open a dialogue with the institutions. So the policy brief, some letters, some communication campaign, we need to move in the same direction to open a dialogue with the new elected member of European Parliament, the ones that will be appointed European institutions, etc. So all this kind of document, tool, etc. We wish that they can it will be used to open this kind of dialogue to interact with institutions. Jasna, Dani, please.
Yes, sorry. I'm taking some notes and maybe I lost some points, but you say that the problem is in particular with people with chronic diseases because they have to pay vaccines or they can find an appropriate vaccine for their condition. I lost this point.
I think as are the both situation, because some patients want to make vaccine, but it's quite expensive and they don't want to pay for the vaccine, and other need be to convince that they need that vaccine. We have both categories.
Thank you. Yes.
Yeah, I see some problems here in the way of the vaccine hesitancy. So I see the distrust in healthcare system. What is I noticed in my work last 5 years, maybe even more, that there is a very big distrust, and there is also the misinformation, disinformation of the social networks, social media. So maybe we'll have something tomorrow about that. And there is no consequences about placing the misinformation on the internet, social media. And this is the majority of the problems about vaccine hesitancy. And then we have, there is no balance between evidence-based information and misinformation. So for the patients, for the consumers, it's very difficult to find in which way who to trust. So that is there is no now explanation in which way to go. And so I spoke also with my Minister of Health how to address this better, to give the actually to patients some choice, but smart choice, that he can or she can see what is the real information, what is the evidence-based background, so to follow research and everything. So we need to talk about health literacy, and here this is the most important thing, health literacy, and that people can understand what they can read. And we're working on it, and we made also some campaign. I will show tomorrow some examples, and we also published some work about it. We talk with the European Court of Human Rights to see what is the right for the choice and the right for the freedom, and is there any consequences, ethical concerns or something. And of course, everything is for vaccination. There is no any doubt about that. And public health is most important. And of course, patient rights are also important, but never can go the public health. Right to public health is always number one. So health literacy for me is the cornerstone, and we need to work on it and to educate people, and this is the only one way to go ahead. Thanks.
Thanks, Jasna. To listening the expert, I were interested to ask to them exactly this point. What do you think about the role of health literacy? And according to me, I don't know, from the Italian experience, is that who is in charge for health literacy? Do you find a multi-annual public program on health literacy with the same dignity, the same attention that is deserved with the national plan on vaccination, the national plan fighting antimicrobial resistance, the national plan on chronicity? If we this is my idea, if we don't change the paradigm, so we don't leverage a multi-annual public program on health literacy that per se should be recognized as one of pillars in the public health, probably we do not advance too much. Today, in my context, talking about the national plan on vaccination, there are some funds also for communication. In the national plan fighting antimicrobial resistance, there are some funds for communication. And for each plan from the that's managed by the authorities, but do not exist a specific national plan on health literacy. Now there is no one from Portugal, because in Portugal, if according to my information, there is a national plan on health literacy a little more developed compared with my experience in Italy. And again, this is from my side, not only related to vaccination, but related to some specific request come from the experience of COVID. If we don't advance on health literacy, probably we lose the occasion to raise information, etc. But the second point, who is in charge to provide a program, a public program on health literacy? Who? Because this is in the middle, This is in the middle, exactly. But if we
WHO or CDC Center for Control Disease, and in COVID, it was a very big problem with the main authority, CDC or WHO, because they were also.
is not defined, is not still not defined, and this is part of the problem. This is part of the problem. If we don't identify first of all, according to me, the need to put in place a national plan on health literacy first, and second, to allocate this role and this responsibility exactly, we are losing the momentum, we can say. But the point of the health literacy is crucial from my perspective. Thanks. Please.
Thank you. Just a little point of information, just checked up the Irish situation here. There is an official sort of recognized issue within the health system, and they're defining health literacy as the ability to read, understand, and use healthcare information. And I was at a meeting last week where the head of the whole social media system, their website for the whole public system, is geared towards a comprehension age of 9, and that their communications in public is built around that. And it's quite impressive actually what you can actually communicate to a 9-year-old in their literacy and so on. So and that is there's a whole lot of other guidelines and so on in that. But I fully agree that if people don't understand what it is they're reading or the information that they're receiving in a way that they can relate to it, we're really sort of losing a big battle here, and we sometimes again get locked into our bubbles that it's academia, we need to write something that's 50 pages when probably 1.5 pages that's well written is far better,
In my work, we saw a lot of problems with this cross-border vaccination. Because we know more than 1/3 of the European population actually live in the border regions, so the internal EU borders. And very often they have different preferences than the people at the central level as far as vaccination is concerned. And of course, their needs are not sufficiently taken into account in the national health policies, including vaccination. We just heard from the WHO presentation as well. This is a very region-specific nature. So we would like very much these voices at the border region are also heard. But on the other hand, we can also demand the countries that they take coordinated actions. For instance, very simple, like people living on one side of the border, getting vaccinated at the other side of the border, but the vaccination was not recognized in the official system in neither of the countries. So these people are demotivated to take vaccination by the end. And yeah, therefore we think the coordination among European countries is very important for us.
Thank you. I take my driver license in Italy and I come to other country, is not recognized. We are talking about this kind of example in a very concrete. No? That is not. There is no reason, etc., etc. Marta, what do you thinking?
Well, almost every point that was shown in this document is a problem that we are dealing with in Poland. But the most important for us is accessibility to vaccination and misinformation. So in Poland, the accessibility is because we have refundation in chosen group, but the path, patient path to vaccination is too long. If you want to be vaccinated, you need to go to the doctor, he need to prescribe you a prescription, you need to go to the pharmacy. If you get luck, there is vaccines, but sometimes you need to go to another or order in this one. So this is very discouraging for many people. And also the problem is that we don't have vaccination in pharmacy. It is problem especially in a village or small cities, because patients who live there, they need to go sometimes 50 or 100 kilometers to the nearest medical clinic. So we've got a lot of problem with accessibility and misleading. We not also need to fight with misleading, but also need to fight with hate, because every time we are talking about vaccination in Poland, there is a lot of hate, not only for us as an NGO, but also doctors says they also need to deal with it. So I don't know if we want to add something more as another topic, another point to this document, but we want to develop these 2 points, accessibility and misinformation.
The document is open, so for sure. What you say, remember me to the experience that a lot of time I had the occasion to talk about my concrete experience before the pandemic, when in Italy it was easier for me to book at home a flight to go 8,000 kilometers away than to book an appointment to a vaccination center for my daughter that is far only 8 kilometers. So we don't need to be convinced, but to make friendly the vaccination experience, not too much bureaucratic aspect. I have to come to the doctor, etc. As you said, and also in my experience, I don't need to be convinced about the value, but probably please take in consideration the time in which I am available to organize this aspect for my daughter, etc. For this reason, in Italy, we have realized a survey in which we have analyzed 147 vaccination centers. There exist in Italy, there are much more, but in 100 vaccination centers, and only 2% of them are open on, it was the burden of the pandemic in the vaccination center. Only 2% are open on Saturday. Probably if they are open a little more on the Saturday, probably it will be easier for the family to go. So something facility, something that can change in the management, that nothing linked with the need to convince, but just to make easier what already exists, no? Some opportunity to book an appointment to the vaccination center. You have to go directly to, there is not something much more easy, could be probably useful. Vida from Lithuania. What is the lacking piece in this structure, in this document that you want to emphasize?
And when I read, I see the main points are mentioned, and I wanted to add to Marta, because it is very good that is included this to more attention paid to pharmacies. Before coming here, I asked president of Association of Pharmacies what is situation now. They are allowed to do this vaccination, but people have pay themselves. And she told me that many people are asking in pharmacies and wanted to be vaccinated here, because it is more easy way to go to pharmacies and to earlier to register to these public institutions and wait for not I come and can go to this procedure. And I think that it is important in this document, and maybe if European Parliament or other European institutions can do influence to our governments, maybe can change this situation. Because, for example, our government don't want to give money not only to private, they are saying like private institutions and don't want to give money. And if you would like to make something, people must pay. But I think maybe it helped to this information to help get this vaccination in our pharmacies too. And she asked to know how is situation in other countries. You said that you haven't this vaccination, and how is in other countries. Can people get vaccination in pharmacies?
Yes.
Yes, in your country.
We will soon be able to get, pharmacists will soon be able to prescribe you antibiotics.
Thank you. And other?
For instance, Vida, in Italy, it was for in the context of pandemic, COVID-19 pandemic, it was allowed on voluntary basis to the pharmacist in Italy after a specific training and authorization to administrate first of all the COVID-19 vaccine, then also flu vaccine. And the feedback was positive from the citizenship, from the population, in support of the public policy on vaccination. And they are thinking, but it's not still the case, to extend the delivery of vaccine for all the adult vaccination. Is not still they are not still authorized. We have realized a survey asking to 700 pharmacists in Italy and 700 citizens. The majority of both target agree about the idea to get adult vaccination in pharmacies. This is something that comes from our survey. But at the moment, there are these two vaccine available in the pharmacy. Correct, Jasna? Please.
I just think Vida and Martha have actually raised a really interesting top view from the point of view of the document. And that is, I think that the document, certainly I think it's something we would suggest anyway, that it states as a value that this is about citizen-centered and patient-centered care, and that barriers to that through protectionism of professions who, who are merely just protecting their profession, between doctors and pharmacists and probably other professionals, is not in the interests of patients. That we should be finding the most efficient way that's qualified and governed and so on to be able to do these things. And that is, patient-centered, citizen-centered, and not interest-centered.
Sorry for that. So, I mean, of course, I echo all my previous colleagues' recommendation. I think that is especially for health literacy, which is a really important problem. I will just add another 2 points to the table. One is we have to also consider about minorities, especially refugees. I mean, Europe now has a lot of issues with refugees. I mean, in our country in Cyprus, as we are an island closer to the Middle East, we have a lot of refugees. So our refugees camps are like a really health exploding bomb with diseases that we have not seen for a long time, especially with people that are not vaccinated. So we have to consider about minorities, refugees, and how to approach them, especially with those flowing into Europe as well. So that's one point that we would like to set out. And another point on misinformation, it's about the rise of AI, of artificial intelligence. So there has to be some monitoring on AI in a way of health of health problem. I mean, anyone can write someone in AI and you get out a response that some 500 people said it. So if you go into AI and you learn him that vaccines are bad, vaccines are evil, and even if one of people go in and ask, are vaccines good, and they will get they are evil, so that's it. So we have to have a way to monitor AI or for health information, and that's my.
May I add something?
Yeah.
I'm a researcher, so. Okay, well, how many percent is the?
Yeah, but I think our point is mostly to settle a regulation to monitor, and before even the before checking the information that they provide. Before.
That would be impossible.
Yeah, I mean, in an ideal environment, in an ideal world, yeah.
It's really impossible to control anymore.
We had a big conversation this morning about this. Yeah. It certainly is something that needs to be addressed, you know, and I think that there have been developments in the area of AI specifically to try and to develop to develop algorithms that will check internally, you know, is this good or is this bad? Because otherwise you could have really mischievous people telling you everything is wrong and everything, you know what I mean, on the basis that you're going to key it in, you're going to get, so that they're trying to actually develop systems that will almost police itself to make sure that what you are getting is actually valid data. And then that, you know, then you proceed with that accordingly. But it is a huge, huge area and it's something that needs really urgent attention. Thanks.
Sorry, please.
Yeah, if I may add to that, because we were also just talking about health literacy. And I think we shouldn't see health literacy in such an isolated way, but always combine it also with media literacy, so that people aren't able to question actually the information that they get out of the AI or out of social media. Because frankly, it's really nice also that the official government is providing information that is comprehensible for 9-year-olds, but it will never be as attractive to 9-year-olds as what they see on TikTok or Instagram. So yeah, exactly. So I think we should always combine these two aspects, health literacy and media literacy.
Sorin first and then.
No, sorry.
Okay, I will be short. I want to say we have the same situation with Ukrainian people because they are coming in our country. They are not staying too much in our country. They are coming to the rest of the country in Europe, but they usually are not vaccinated and they don't want to vaccinate. So sometimes we have some problems because some ill are coming to our people too from them. We are very friendly with them, so we have a lot of rules. But
friendly. Another thing is diplomatic
I know, but was a special situation, so we couldn't, because otherwise they couldn't come to our country.
This is discrimination then against your people.
Yes,
in the country.
yes, it is.
If they
it is.
can enter and be vaccinated, and
Yes, but in Romania the situation was very difficult. A lot of people from Romania took some people from Ukraine at their homes and stayed there for weeks or months or things like that, because the situation in their country is desperate. So that's why we didn't follow these rules. Yeah. It's nice.
Can I
just a quick, and I've stopped talking there. Stop talking. Yeah, just on this though about, you know, Ireland also has taken a very substantial number of Ukrainian refugees from the war, and the first thing that the Irish system has done at the time was that that they were all housed, that they were all given free access to our medical system, and that for a group of not only Ukrainian patients, but also ones in what we call direct provision. There would be people coming from perhaps the African regions or whatever, fleeing for their life, that they were given for more than the actual local population, unique patient identifier records. And there's a conference tomorrow that is actually going to highlight the importance of electronic patient records, that there was an outbreak of measles in one of these residential settings where they were staying, and it was completely managed and eliminated simply because of the fact that the records were there and they could actually intervene. So while we can't be like, people do have responsibilities, but there's also a responsibility on the system to have good systems to be able to intervene and take actions when they occur, rather than saying it's, you know, the individuals at fault. Sorry, just thought I'd throw that out there.
No, I just wanted to jump in for a second about the AI issues, because 1 week ago, the European Commission launched the European AI Office, which will foster the development and use of trustworthy AI and international cooperation on this. Apparently, there is not a unit devoted to health, but of course, I mean, there's the hope that they will understand that this aspect is not, I mean, less important of the others. So let's see.
Yeah, one of the aspects talking with Steven, it was the lack of ethical code, ethical framework when we talk about artificial intelligence in different aspects and across the world. So with a very potential opportunity, but also with very high risk if we don't manage. Renata from Bulgaria.
Thank you.
I try to remember the country also, just to, remember each other, etc.
About the policy document, I think that all topics are very good written. I would add something which is related to the access to vaccines. And if we want to have equal access, we should involve all the ministries of health, because they should be involved in the process at all. So I would give you that as an example. As COVID-19 crisis we had, all the ministries should make requests to the pharmaceuticals companies for all the vaccines, because we had that problems with the lack of vaccines, and it was because of that delay. So if you want to have the good recommendation, we should involve all the ministries and to be sure that everybody will have the equal access, because other countries already had it and we were late. So this is one of the recommendations which I would prefer. And the second one is to involve informational campaigns to the citizens, how to educate their children. That's it.
Just to come back, the access to vaccines related to different target population within your country. Okay, thank you, Renate. From Malta, Christine.
Okay, 2 short comments. We're at the end of the line. So one is about, we're speaking about preferably adult vaccinations and the equity in vaccinations. And we already mentioned refugees, but there are other groups like prisoners, like drug addict, homeless. So I think, I don't know how it fits into the document, but we as health advocates, I think we should make bridges on other civil society organizations who deal with such vulnerable populations, which are not our usual clients as patient NGOs, because they're not patients, they're refugees, they're homeless, they're prisoners, maybe they're in prison. But they're adults, they're in a vulnerable situation for communicable diseases. So that's one thing. And the other thing regarding the document, one of the more emotional recommendation is the number 7, to prevent cancer through vaccination, and also to prevent mortality and morbidity, for example, through the influenza vaccine and the COVID vaccine. God forbid another happens. So maybe it should be not number 7. It should, policymakers are not very keen on reading long documents. So you hit them in the heart at the beginning so that when they get tired, so maybe we need a shorter, more emotional, more so speaking more about saving lives from cancer, saving lives from pushing it up in our priority. Not that the others are not important, but sort of when a policymaker is reading a document.
Yes, to come back to the vulnerable target group, not only the refugees, but also other categories. This is the reason we talk about the need to involve the so-called intermediate body of the society that are in touch with different categories, even are not patients, as you said, but are the ones close to the, talking about prisoners, talking about homeless, etc., etc. And in one of the recommendations is written, they need to recognize the role of the Citizens Association. And in that recommendation, we can probably add at this point also to better reach the minority target group, not yes, what you say. This document is not produced by industry, is not produced by the institutions, is produced by citizens and people who advocate for. So this is important that the also the soul that we can identify in the document come from the citizens. No, it is important that is a characteristic. It could be short or not short, etc. But it's important that come from the daily experience, come from the citizens, the intermediate body of the society, patient advocacy group, etc. This should be one of the add value. The second is that come from a different context, different countries. No, that we can try to leverage aspects that are in common, but also different sensibility as or unmet condition, etc. Last but not least, from Austria, Christine.
I guess that a key word in our discussion is transparency. So you only can reach people to vaccine if you provide transparent information about the benefits, but also about the possible side effects and also as well as complications of a disease occurring in non-vaccinated person. And this is, I guess it's very important, and you have to do it in a way that everyone understands. So maybe you can reach them with a one-side paper, but also you can reach them with a YouTube video. I don't know, maybe for a younger it's easier to reach them with such media. And what's also very important, it must be a free and individual decision. In Austria, we are very vaccination critical people. And during the COVID-19 pandemic, there was the discussion about a vaccination duty, and that totally splitted the society. And so it must be a free and individual decision of each citizen. That's important for us.
Thank you. I agree with you that probably talking about the impact of vaccination, the two words you mentioned, side effect and complication, that exist for any kind of medicine, drugs, etc. but in the vaccination policy has been translated like a taboo. It is probably didn't help in the comprehension, in the attention of the role of the vaccine, something that we need to be aware, and also the follow-up, the importance of the healthcare professional to have in mind this aspect, to explain, etc. And so I agree with you, and this summarizing a transparency, more transparent communication from the benefit, but also for the potential side effect, complication, etc. Okay, thank you so much. I think that we have collected a lot of insights, suggestion to enrich the document. If you want, as I hope, to help Daniela, please send your idea in a short sentence, in order that we have 3 pages.
Yeah.
3 pages, okay. So 5, 7 pages, I don't know how long it will be, the document, but then we try to summarize to be much more consistent. You have 3 weeks, so we can probably, our expectation is to receive your feedback, and our commitment is to finalize. After that, we will send to you the final version, putting directly the logo of your association, asking confirm or not, okay, in order that we can advance and to use after the summer break the document when we have to. I know that Vida want to meet his new elected member of European Parliament, Andrew Kaitis, the past health commissioner. Okay, which kind of document you have to talk with him? You have this document, okay? Feel free to use, it's not mandatory, but just to, okay.
Yes, thank you again to all. I would like to take some of your insight. So I repeat that what is said from Mariano, that I need from you your written proposal, but I would like to underline something said today. One is to do bridges with other associations, in particular with the ones that work with refugees, or so it's important to start thinking at the other association that you think could be interesting in join us in this effort to write down this document. The other thing, it's the emotional language. I don't remember who said something about that, but I think it's important to write down this document maybe in some different ways, because it comes from citizens. So it's a good idea maybe to use a way and a language that is different from the normal institutional documents. So I think it's a very important.
But also the recommendation can help us to find the way to better.
Yes, redefine and give us the the chance to write down a document that seems to be written from citizens, because it has. And the other thing, it's also from the WHO presentation, SIF gave us some true story of the impact of their works. And I think if you have some concrete story or something that have an impact about vaccination in your country that could be tell, please send to me, because I can collect in some way, reading the document also in the campaign. I don't know, but true stories or testimony are very important. And so that's all that I would like to underline from today. And so the 12th of July is the deadline. But now, the next hour or 1 hour and a half, if needed, will be led from these 4 guys and to work on our communication campaign. So please, the floor is all your, no, Mariano, no.
Are you presenting a new document with our some suggestions now, or do we work on the old document?
Yes, please.
On the old document.
Yes, work on the old document and send your suggestion, and I will put all together the new one, this one, and I will try to summarize all the suggestions. Sorry, Mariano.
No, my very bad idea when you talk about the emotional.
Yeah.
You use a different. This is for you. Different calligraphy for each recommendation, and then in capital letter to put the same content in capital letter, but using my calligraphy. Si dice calligrafia, calligraphy? Sì. Calligraphy, no? Okay, it's our and that is writing is different because it's different from each one. Do not exist two different, not two same calligraphy. Okay, it's bad. It's too much bad. Forgot.
I will talk with him. Thank
Okay.
Okay, all sorted. Wonderful. No, all good, all good. We shall weave it in for sure. Thank you very much. And thank you all for your thoughts just now. I think we can all safely say that that will feed really nicely into this conversation about communications. We've already touched on and hopefully can pull some more insight from some of the things you've already said. I'll just start with a really quick introduction to us at Stripe Health before jumping right into our communications thoughts and sort of getting a bit of insight from you guys as well, beyond what we've already discussed. So we are Stripe Health. We are a London-based global healthcare communications and public affairs agency. We're really focused on bridging that gap between the scientific and the public understanding. So this is very much our interest and our bag. We're a small but mighty team that you see before you, and we like to think big and small to create differently thinking campaigns and activities that really create an impact. Our mission, so we want to get people talking, which is why we are here today. And we do that through starting conversations, stimulating that debate, driving change, and then striving to make a difference. So without further ado, I will hand over to the team.
So why are we here today? As you can see from the banner there, and you may also remember last year we launched our vaccination campaign to drive vaccine uptake across the EU and also combat common myths and misconception around vaccination in the EU. The campaign ran from December to February and raised awareness and also drove lots of engagement across the EU. And so today we want to build on that momentum and kind of start thinking about how we can launch that second wave of the campaign. So without further ado, but we want to do it a little bit differently this year. And that is where you guys in the room come in. As member organisations, we've already seen today kind of how you really have that expert insight into your local nuances and the environment that you operate in. So we really want to co-create the second wave of the campaign with you guys and kind of really get your thoughts and insight to shape the campaign. And then secondly, we know that kind of broadly health inequities and misinformation are major issues affecting vaccination uptake. So in this session, we want to further build on these themes with the policy briefing alongside other elements that you see as important in the space. So how exactly do we want to do that? So today's objectives, we want to firstly understand the challenges. So understand from you, what do you believe are the key barriers to vaccine uptake in the EU, with a focus on misconceptions and inequities. Secondly, take insights to inform the campaign. So we want to hear your thoughts on what would make an impactful and effective vaccination campaign. And then thirdly, we'll shortly start to kind of bring you into our other room where we are set up with our cameras and tripods for content capture session for campaign assets. So capturing key shots and footage with your participation to be used in our campaign assets and outreach. And a bit more from Jordan on the actual content capture.
Thank you, thank you. So kind of as Sarah has said, there are kind of various themes that we're looking to explore. All of the relevant questions should have been shared with you ahead of the session, so in your kind of pre-read materials, but worry not, we will re-prompt you when you come through to us. It will happen either with the time we have left today or through into tomorrow. The first theme is kind of building on the awareness of the campaign as it stands, so really looking at kind of raising awareness of #Vaccinaction, delving into kind of what it means and specifically what it means for you guys, and then stitching together some nice content of a sort of a call to action and a statement. The second is re-delving into those kind of misconceptions, inequities when it comes to vaccination, anything particularly each of you would like to highlight. We'll also be capturing some headshots, so that's the static, and the team have been capturing some shots throughout the day as well, so we've got some nice B-roll. And then the last bit on the bottom there, beyond the content we captured today, any kind of key themes that come out of the discussion that the team will walk you through, we can look at how we can also weave that into the campaign going forward. And then finally from me, just to give you a little glimpse of the process that we're working with and then some key timelines for yourselves. As you'll see across the top, we have the workshop today. From the content and the discussions, we will then go and develop various pieces of content, visual assets, written posts for the various social channels. There's then a content approval window. So that is the kind of gold yellowy box on the left, where we'll look to get your kind of review and feedback on that draft content late July, early August. Once that's all approved and everyone is happy with it, we then move into translation. We know that kind of providing these assets to you, if they are not necessarily in your local language, the engagement can be much lower. That would happen kind of early August. And then to give us enough time to get everything right and then time it to sort of everyone coming back after summer, people going back to school, we then look for the campaign to go live and that content to go out sort of mid-September, early October. Back to you.
Thank you so much. So a little bit of housekeeping and just taking you through how this will run before we get rolling on the discussion. So first things first, as Jordan already touched upon, the guys are going to be next door running that filming, and we'll send you in kind of 2 at a time. We're conscious that a few of you have priorities tomorrow in terms of speaking in the session, so we're going to start with you guys just to make sure you're then all sorted and don't have to worry about that tomorrow. We have talked about the translational things. So in terms of your points, what we'd love is for you to record it both in English, but also in your local languages. As Jordan touched upon, it just creates such a better impact in the local markets. The other thing just to say is we're very friendly. I promise it's going to be fine. So just talk to the team. If you'd rather just stick to a headshot, then of course, let them know that. But what we would really appreciate is you lending your voices to the cause and sharing your thoughts. In terms of what we're looking for in terms of the content and why we've gone for sort of video ideas is just that people, as somebody already touched upon, are really what bring other people along on the journey. So selling that story, talking about your experiences, talking about what's happening in your countries is so important. Also, just in terms of a practical social media perspective, those video pieces really just take so much more engagement. People spot them, people engage with them and find them much more sort of engaging. So that's just our rationale behind that. any questions before I move back on, just in terms of logistics? Wonderful. Okay, in that case, let's set about some discussion. Some of our questions do already touch on what we've already talked about, but what we'll do is just slightly look at them from that communications lens and what we can do to make it really, really clear, really engaging, and that content really sing on social media. So first things first then, why is the vaccination campaign important, and what would you like this campaign to achieve?
I say something. For my side, it's important that the overall message is that the campaign is coherent with the title of the today meeting, Active Citizens Advocate for Vaccination Across Europe. This is important to highlight the role of the active citizens, active organizations, etc., involved in vaccination policy.
Are you talking about a specific vaccination like flu? Or are you talking about a generically lifetime?
So I think what we had in our minds was to talk about access to and uptake of vaccinations more generally. But equally, if there's any specific vaccination points on particular, for example, the flu vaccine, as you mentioned, that you'd like to discuss, then please do raise that still.
So maybe we also emphasize the throughout life course and the equity issue.
Yes, absolutely. I think that equity issue is such a big one. And is there something in particular that you have in mind for that? Like, what is the equity issue in Malta, for example, or more generally?
It's a certain population groups which fall between the gaps.
So in terms of, for example, those population groups that you mentioned, are you wanting to speak to them and tell them that vaccinations are an option, or to raise awareness of them slipping through those gaps? What would be your goal for that?
I think even the policymakers should be aware of that, because maybe these vulnerable groups do not have much access to these campaigns in the first place. So we have to go through the authorities or through civil society organizations which cater for them, which advocate for them.
Okay, wonderful. Thank you. So maybe that ties in a little bit to the point that somebody made earlier about tying in with those other organizations that, for example, are looking at migrants or are looking after people who, are homeless. Is that the kind of thing that you have in mind? Yeah. Lovely. Thank you very much. One thing that was also mentioned earlier was about sort of sharing those people and personal stories. Is that something that you feel would, impact well in your markets?
Or if there's no kind of thoughts on the impact, has anybody seen any campaigns where they've used patients' voices that you feel has been really effective?
I would think because I participated to the European Beating Cancer Plan this year, and there was very strong video by also the commissioner and all the MEPs who has real stories for their sisters, brothers, mothers, and how they died from cancer. And even though some of the MEPs have cancer, so it was very strong and powerful, I think.
Yeah, that's a fantastic example. Any other examples that people have seen that they felt are really good?
Yes, I don't know if I mentioned to you, but an Irish campaign on HPV made from girls that had HPV, and also from one in particular that I think died from HPV, I think was very impactful, and they measured the impact of this campaign, and it has a lot of impact. So I think it could be useful to see it. I don't remember, but maybe Stephen can help us to find it.
Yeah, I will. It was very powerful, and the young lady was dying, and she gave her testimony and won the love of the country.
Wow.
And there was also another champion lady called Vicky Phelan, who died of cervical cancer, but they hadn't been disclosed the outcome of various screenings, and that started the whole, identified the whole debacle in the Irish system, and it created huge momentum to have in law open disclosure, which is a huge, very important development. So there are a number of, there are a few there.
Amazing. That sounds.
I was just trying to find her name, and I feel so guilty I can't think of it. But yeah.
I mean, if you could, the examples that have just been shared, if you could share those campaigns with us, that would be massively appreciated, I think.
Actually, in Croatia, there is a more campaign anti-vaccination than vaccination. So, fortunately, they have testimonials like what's happened, like bad effects, and they are very, very strong. But we are stronger, I think. At least we are. No, this campaign, you mean video? No, that was video for the 14 European rights, like for the general. But for vaccination, I published the paper for Croatian Medical Chamber about this vaccine importance and health literacy and everything, and like this information from the European Court. That is what I explained before. But campaign, yeah, unfortunately, we are not standing good with the campaign.
If I may, one of our members association, cancer-related members, they started a campaign in 2010 for HPV vaccination, and by 2016 we managed to have the Ministry of Health have vaccination for HPV in schools, and after by 2019, 2022, we also have some videos and animations and not animation, sorry, videos and leaflets, and with children saying that if you have a vaccine to save your children, will you do that? So that was really impactful. And also we have a video from the former Minister of Energy that she put under her auspices the campaign, and now HPV vaccination, it's in schools and also in our general health system.
Yeah,
I don't know if that's something is.
No, that sounds really good. And I think there's a common thread between all of those examples, that they used video content because it makes the issue much more human. So that's exactly what we're trying to do with you guys. But just an additional question, I guess, and it will be personal to each of you. But if you had one ask of your policymaker, what would that ask be? So if you had one thing you could ask your policymaker to change to make vaccine uptake better in your country, what would that thing be? Because the other thing that tends to do really well in campaigns is having one really clear call to action, which is what, generally kind of gets the best results. So I'm just interested to hear from each of your perspectives what you think that call to action should be, or that one thing that if your policymaker could change it would be great for your country.
Always communication, number one. Good communication with the public and for policymakers and consumers.
Okay. Any other thoughts?
Make vaccines accessible to everyone.
Okay.
at every opportunity of an encounter with a healthcare professional that you're reminded.
Okay.
When you went to the doctor, when you were smoking, you constantly got bad for you, bad for you, you know. And finally, for a lot of people, the penny drops. And I think part of that then also is the need for an electronic patient record that can go cross borders and everything else, that we need to be able to pick up on who isn't, and to follow through with those messages.
Yeah.
And also one thing about the classification of the side effects and the responsibility of side effects, because this is the most thing for the people they have to hear about. Who will take responsibility if something bad happens, and so this is also very important to communicate before that people are safe, and that nobody can guarantee, like for any drug. And this is also one thing.
Okay. Better spend money in prevention than in medication.
Okay. Any other thoughts before we move on? Okay.
Just whilst we're on this question, just one more thing that I wanted to sort of get some thoughts on was about, there's been a lot of mention of misinformation and quantity of misinformation, and also in some of your markets that anti-vaccination is of higher prevalence than pro-vaccination conversations. So is there room in social media campaigns and beyond to share that positive information and that more factual, definitely fact-checked information? Is that something that you think your markets and people, whether that's policymakers, general public, doctors, nurses, want to see? Perhaps not. Perhaps the people focus is maybe more where what's driving this. Okay. In that case, we will move on to the next question. What do you think the key barriers or challenges are in vaccine uptake in your markets? We've talked about vaccine hesitancy a little bit, vaccine inequities, that lack of communication. Where do you feel the main challenges lie?
The bad informational awareness campaigns from the Ministry of Health.
Thank you. And just for sort of clarity, when you say bad, is it lack of or the wrong information?
I would give you example of the COVID-19 and why so many people were not vaccinated. First of all, they missed the important month to raise awareness to the people. Second of all, they were using stupid photos. Like, yeah, they were very stupid.
Okay.
I can show it to you.
Yeah,
and
please.
if you see it, you're not gonna vaccinate yourself. You're gonna laugh at them. That's it.
Okay,
so
I see.
I'm gonna show it to you.
Please do. I'm
Yeah,
very
I
intrigued
will.
to see this.
I
now.
will.
Thank you. Okay.
I mean, a challenge that we see in our country is that even more and more healthcare professionals are anti-vaxxers.
Okay.
So, so it's kind of, I mean, like biting their own science. So it's really hard to convince now, even the healthcare professionals. And how do you convince the healthcare professionals? For example, in COVID-19, all the healthcare professionals that they were unvaccinated, they were not working. I mean, by a regulation of the Ministry of Health.
Right.
So, I mean, even for that, it's a huge challenge.
Yeah, absolutely. Absolutely. When the health system itself is not pro it, it's, I'm sure, very difficult to communicate otherwise.
Just a follow-up question on that. Do you see that those HCPs that are anti-vax, do they have a big platform and a following, or do you think it's quite sort of fringe?
I mean, we're a small country, so it's mouth to mouth, so everyone knows everyone. So, I mean, of course they have the open platform for social media, but even into the hospitals and they have their small groups that they are anti-vax. So we saw in the COVID-19 pandemic that those community was risen at a really, really bad stake. So that's why of the implementation of no working for non-vaccinated healthcare professionals.
Interesting. And one question for all of you actually is that when you look at social media in your day-to-day lives, do you think you see more positive vaccine content, or do you think you see more negative vaccine content on average, if you had to say?
It depends of your searches. I mean, if you are a pro-vaccine, you see more pro-vaccines ads rather than non-negative. I mean, if I compare with the person next to me, if he's searching up for vaccines are bad, and so they will be targeted more for anti-vax. So
yeah, but I mean, in the more sense of obviously TikTok is much more algorithm based.
no, negative. I mean, negative. Yeah, more negative. If you think the general algorithm is more negative.
Okay.
But I think now Facebook, Meta, it's much more careful about this kind of information. Is more sensitive, and if you want to make an article or something, sorry? Oh, sorry. I think they block you or put you to say where you have this information, if it's true or not. In the past time, I didn't saw too many anti-vax posts. But in the same time, if, for example, on our page, we try to say something about this subject, we get a lot of hate. Always, it's somebody who will say it's not okay to vaccinate.
Okay. And has any, yeah.
Yeah, I just want to ask a stupid question, because now we talk a lot about the anti-vaxxers. So we have two extremes. One extreme is people who accept the vaccine, the other extreme, the anti. But actually, in between, you still have a lot of people who are just hesitant, probably.
Yeah.
Maybe it's also useful to educate this group of people and to communicate them with them better so that they can turn into the positive direction.
Absolutely, that's a really important point. Definitely.
On that, and also with there are some religious minorities or religious beliefs that their bodies, their temples, so they have to be pure, not to inject anything on their bodies, even tattoos, or I mean even earrings and everything. So also it's a really there's a challenge in the religions as well for some people.
Okay, yeah, absolutely. And just one more question for you, if you don't mind. I know you mentioned earlier a little bit about the border, the challenges around the border lands. Is there anything that you feel are those main barriers and challenges for those populations in particular?
Yeah, because every country has its own infrastructure, national health systems, and yeah, understandably, their disease burden also different.
Yeah.
So you see the national policy has different focus. But then these group of people living in the border region, they are more connected to each other despite the border. So for them, the border doesn't exist.
Okay.
It's like the Belgian side, if you see the Flemish speaking people feel probably more closely related to the Dutch. So their vaccine attitude is a bit more pro-Dutch. So in a way, well, there was also some research supporting that their vaccine acceptance is rather low compared to the border region that's closer to the French side.
Okay. Interesting. Okay.
Yeah.
Thank you.
So if you can use that insight a bit.
No, definitely. I think that is really interesting insight and one that probably doesn't often get spoken about. So it's helpful. Thank you.
Yeah, and also I think border region is a good place for mutual learning. So one national policy doesn't exclude the other. So you can maybe activate the public health authorities to communicate better with each other, to have this population more motivated.
Yeah, absolutely. Thank you. I'll just take a really quick pause now to send the first group of you next door just to do filming, if that's okay. So I wonder if, Andreas, if you could go, and potentially also Christine from Malta. I'm aware I've got two Christines, but about you, if that's okay. It's just if you go out this front door and take a right. No. Just picking the countries that are needed tomorrow.
The rational is another one, as because we have received 9 presentations for tomorrow morning. Tomorrow we have time to show case history, initiative at national level, etc. So today we have started to record with the ones that tomorrow morning have to be here in the plenary room for the presentation. And they are 2 of 9 that have provide to us their presentation. So this is the reason, no other.
Yeah, absolutely, absolutely. Has anyone got any other additions to the barriers and challenges, or shall we move on to the next? No? Lovely. Okay, in that case, our next thought is about what you'd like this campaign to look and feel like. The audiences in your markets that you want to reach, what do you want them to see and feel when they look at our social media?
Positive feelings.
Definitely. What kind of positive feelings would you like them to feel?
Like people to understand the problem and to understand how we can solve it together.
Absolutely.
But I also think we should make sure that it doesn't look too much like communication that is coming from a public authority. Because also when I talk to our partners, we heard that often people are more reluctant when they have the feeling it's information that is coming from public authority. So it should be authentic and
Yeah, definitely. I mean, so with all our talk about the people-focused look and the kind of engaging and the point that Stephen made as well about the language we use being simple and effective and clear, do you think that would aid that problem?
I think so.
Yeah.
But maybe also that we tried, I don't know, that's just an idea that just comes up, that we try not to make it look too polished.
Okay. Do that. Too polished. Wonderful. Any other thoughts on the look and the feel? Anything that doesn't work, conversely, is there anything that you think your markets wouldn't enjoy to see or would ignore?
One example of that might be that a campaign that's kind of based on fear and making people scared to take vaccine, in the sense that if you don't take this vaccine, you're going to die. That usually doesn't work with people. So that's one example, but there might be other thoughts around what you feel does or doesn't work.
Actually, I was thinking exactly about that. Of course, we don't want to scare people, but at the same time, vaccination consequences not get a shot persevere. I mean, it's a serious topic.
Yeah.
So at the same time, I think that probably use only, smiley faces, unicorns, like that. I think that probably also, sends probably not realistic message.
It's about meeting the right balance between positive action and also there is a real world consequence for non-action as well. Yeah. Any other thoughts?
Maybe we can try to make it somehow engaging so that people also have the feeling that they actively learn something, I don't know, through quizzes or something like that.
As somebody who uses social media, when do you feel most engaged? As in, what kind of campaigns make you feel really engaged in them?
When, for example, my opinion is being asked, or yeah, I can indeed learn something. Or sometimes you also have, for example, on Instagram, these quizzes that there's a question being asked, and when you click the right answers, there is like confetti popping up. Yeah.
And anybody else, what makes you feel engaged when you're looking at a social media campaign? Is it kind of the cool gifs? And everybody loves gifs, so people are going to be like, we love those. But is it gifs? Is it video? Is it quizzes? Is there something else you've seen that's worked really well?
If the story speaks to me, like it reminds me of my relative and people around me, and yeah.
So like seeing yourself and
something. Exactly.
Yeah.
Any further thoughts on that? Anything else that makes you feel really engaged, that really makes you take action? No? In that case, we shall move on to my final question before we sort of open the floor a bit more to just general debate. What is most important to you in terms of this campaign theme or topic? We've talked about health inequities, we've talked about challenges, we've talked about AI, we've talked about misinformation. What is, if you had to pick one, your number one important priority?
I would use misinformation.
Absolutely. And how about the sort of marginalized groups we talked about? Do they fit into those priorities as well? Is that anyone's number one focus?
Maybe also the person from Romania will support me, because we have a problem with the Roma people a lot. So they are also not vaccinating themselves, and they're putting also their families in risk. So we should think about the marginalized populations. And how to involve them in that process. They have other NGOs which are only for Roma people. No.
Yes, I support you. We have the same situation, but I think the education level it's important too, because if people are less educated, they don't believe in vaccination, and in the same time they don't want to be vaccinated. But if the people are more educated, they understand, they choose differently the sources to inform themselves, and they take another decision. And I think if I see a good headline and a nice picture, but with impact, probably I will looking to see more what it's about. I don't need to see everything in the first time. And maybe after that we can make the people to choose what they think, not necessarily to give them the solution, because it's a big debate in this field. So let him we can let them to choose, and to in the end to see the result of their choices.
You made a really good point about people who are undecided and a little bit hesitant, not quite sure. If you kind of put yourself in their shoes, what do you think might have the most impact on you?
Give me a few examples. How would you try to convince me?
Let's say you are someone who is skeptical of the flu vaccine and you're like, oh, I don't know if I should take it this year. And you saw something on social media that was pro the flu vaccine. What type of content would have the biggest impact on you? Does it come back to that thing of seeing yourself in that person who's giving you the advice, or is it something else?
I would rather go to my doctor to ask for advice.
Okay.
Instead of searching for information on social media.
Okay. So we can say something like, you can ask her the comment. If you're vaccinated or not. Many times it's happening like that. You ask the wrong people.
Well, actually, traditionally, in all of the previous vaccination campaigns, we've included a note that says, go speak to your doctor.
Yeah.
Do we still feel that that's the right thing to be saying? And that's what we want to push people to do in the end, is to speak to their HCP?
That's a different campaign, isn't it?
Yeah.
No, I think that's in my summer preference would be the bit I know about social media, which is immediately guided by my daughters, that people go to it for entertainment, for hearing things, and that people like to be part of the crowd, whatever that crowd may be defined as. So, like when we ran a big campaign last year on flu vaccination for kids, we called it Flu United, because kids took out in football jerseys and so on, the poster shoots were all around that, but it was building this image that we're all united for this. You know what I mean? It was a soft sort of sell, and we had the social media commentators and so on. So, but to answer the question, one size doesn't fit all. That's the problem. Do you know what I mean? Because we heard, I don't know, somebody mentioned today, Austria or where was it, that I think it was to have a split society because somebody said this is what you should do. Or, no, your duty, I think is what you said. This was your duty to get the vaccination. And that split the society. So you have to be careful within the different cultures, you know.
Yeah.
But certainly, you know, again, you can't incite that social media is there as a buzz. It's an endorphin buzz. You know what I mean? It's you know, you're not there to go looking for comments. You know what I mean? But then you're responsible, making responsible comments. You're saying we go talk to your doctor. But we've already said that some of the doctors may not be the ones that would be, you know, certainly some, I think nursing is an issue in uptake of vaccine. There's certainly the flu and so on, the COVID. So have to be careful with your moving back. Do we feel confident in the statements we're making? Have we got the evidence here when you finally do this game? Do you know what I mean? That everything we say is provable.
Yeah.
You know,
it's a good point.
So to know the evidence that we use to make the statements gives you comfort.
Does anyone else feel differently and actually feel that saying to people to speak to their HCP is the right thing to say? Yeah.
I think, as Stefan said, this would be a totally different campaign that we are aiming at. So
maybe not this year.
it's such a challenge for you guys, I'm afraid.
No, it's okay. That's we like a challenge. And another question, actually, because we just thinking a little bit more practically, I guess, in terms of reach of the campaign. Health influencers are obviously becoming really big now. Lots of young people, especially younger people, look to TikTok health influencers for health advice, for health information very often. Do many of you have links with influencers within your markets, or you don't really speak to them as an audience? No?
Yeah.
Oh, you have?
We've used them for our campaigns.
Flu United.
Yeah, and we use got about 100,000 or close to anyway, but she's a pharmacist.
Oh, that's great.
So we tick a few boxes. You know what I mean? Like we just don't go for because somebody's a doctor. Trust me, I'm a doctor. This is somebody that could relate to the age group that we were trying to target.
Anybody else worked with any influencers?
I think that for the different target groups, we should use different people.
Okay, yeah. Well, I think the plan from our perspective was always to create something. We send it to you guys in a toolkit where you have all of the assets, the content, you can translate it, adapt it to your local market, and then how you disseminate that within your market, whether you share it with influencers, if you have those kind of relationships, or you share it with other organizations that are pertinent to you that might want to repost it. You know, obviously, the more people that kind of engage with it and repost it, the better it will do. So I think this year there's a little bit more of a focus on how do we use partnership to make it more successful, basically.
Yeah, and that needs a lot of thought because in our experience, all of this costs big money.
Yeah.
You use social media, people, you know, like one bit of the campaign for a few comments and stuff like that costs 5,000-6,000. So it's not something that you can say, right, put one for every kid.
Yeah. I mean, I think it's difficult because there's obviously a difference between paid social media where you're right, you know, putting 6,000 behind something is obviously going to make it well, exactly. But we're obviously focused on earned, and in some ways I think, especially now in a more digital age, people are a little bit more skeptical about paid content in a way that they probably weren't previously. So earned is always going to be the most valuable thing. And you've all got channels, you've got social media channels, you've got personal channels, you've got partners and their channels. And I would just encourage you to, when you do get the content and everything is kind of wrapped up, that we send it out to as many people as we can, because it can only help to get the message out there.
Absolutely. Just a super quick one. Oh, I think Lynetta, if you're okay to head into the filming next, that would be wonderful. Quick interjection to say that. Then we can continue with you. with the sort of discussion.
I mean, does anyone have any other thoughts on the campaign? Oh, yeah.
It's not about the campaign, but it's thoughts about the previous the misinformation, disinformation. It's also a matter of time, and it's easier and quicker to search information on social media instead of to go to the European vaccination information portal that we showed last year with our campaign, because we have source of information that can help us to have the right or the official information about vaccination, but it's too long, to not so easy as to scroll down the. So I don't know how, but we should put the information vaccination portal contents on the social media to push the institutionals and to give them a aura of more interesting things, because we have the right sources, but we do not have time and willingness to consult them. We in general, I said. So we have to do a reflection about that. Just this.
That's super interesting as well. In terms of your own social medias, what platforms are most popular with your memberships that you work with? LinkedIn. Interesting. Okay.
Facebook and Instagram.
Okay. And do you think that the difference between your organizations is your membership a bit more professional, and they're therefore okay, so they're more kind of policy people. Okay, interesting. And we actually have not done LinkedIn for the previous campaigns, so maybe that's something to explore this year in kind of making the content suitable for that platform, if you feel it's going to be of use.
Also because now we have an account, a LinkedIn account.
That also helps.
Our organization is not membership based.
Okay.
We're a patient advocacy body, so we're there for patients that have had problems with the system.
Okay.
Usually bad problems, and you know, we see ourselves as a patient's rights and upholding, you know, how to say, walking the walk with patients.
Right.
But because of that, we get an insight to a whole load of things that aren't working, you know. And that's why, like, LinkedIn would be where we get our points across to the establishment.
Okay, amazing. That's great to know. Any other thoughts on channels? And I mean, do some of you have websites that perform really well, or do you find that's your best channel? How many of you don't have any social media accounts? Does anybody have nothing? Okay, so everybody has a social media account. That's good. Okay, yeah. No other thoughts on channels that work well for you, or? Yeah.
Interesting. Okay. What was it that you saw when you were?
Pardon?
What was it that you? Oh, sorry, I forgot about my microphone.
No.
What is it that you saw when you were going through TikTok on that sort of patient right topic? What?
I was very interested in the age group.
Okay.
That were responding. They're only like 20s, 30s.
Okay.
I thought I would have gotten older because for obvious reasons. But seriously, no, I was surprised at the age group that were really in there.
Okay.
You know? Wasn't much, about 10,000 to 15,000 reads or something like that, or whatever. There's a market there.
Does anybody else use TikTok as a channel for their organization? Not quite gotten there with the dances yet.
Indeed.
He is, yes. Okay, interesting. Any other questions we had before we've
the main ones?
Oh,
pinch
yes,
my
of course.
sheet. Thank you so much. Just double checking we've not covered anything. In terms of one thing I do want to understand a little bit from you guys about your local markets is about the government's priorities in this space. So is it something that's being actively spoken about by your local governments or your MEPs? And is that being communicated already?
I know in the Flemish government, they have held a big conference beginning of this year. And vaccination is one of the health policies. They have ambitious goals to reach by 2030. And a lot of issues on vaccination was discussed, like communication techniques, and confidence. They have also, Marlene is going to present it tomorrow.
Yeah.
They have done big study on that.
Okay. Is there anything else from your side, Mita, that we've not
I don't think
covered
so,
off?
actually. That's probably everything.
Those are the majority of our thoughts. Thank you so much for sharing your points of view. I will just put up on the screen, in theory, will she? This is our email address. Obviously, as well, you have Daniela, and we're all back in tomorrow. So if you have any further thoughts, or you see any campaigns that you would like to share with us, any ideas, musings overnight, then just let us know. And we will start to put together a bit of a plan. Daniela.
Yes.
As in the other room, they are taking so much time
Yes.
to register. Maybe it could be useful to prepare some sentences to use when they have to register, so you can help them to be prepared for recording, because it could be quicker, and then we can go ahead with the last points of the agenda. So if you can suggest how to prepare for the interview, and then I'll call Mariano for the last part of the meeting.
Amazing. Yes, absolutely. So what I'll do, I'll run you through quickly what the guys next door are going to ask you. You can have a little bit of a think. Obviously, we can discuss if you'd like to, or more on an individual basis. So one of the things they're going to ask you to tell them is what vaccination inequity you would particularly like to shine a light on. So that can be broadly or in your country specifically. We want to know from you what you believe is the most important thing or element or factor in vaccine uptake. And then finally, about what vaccine misconception you would like to address. And again, that can be in your local market or beyond. The other is just simply a sentence which the guys will show you that we'd just like you to read out. But that is all. That is all from our side.
They're not scary.
No,
They're very,
very
nice.
nice.
So if even if you stumble, it's okay. We have time, so we can do it slowly. It's all good.
What's the sentence you're reading?
So what we would like you guys to say, and we're going to sort of stitch it all together to show this united front that is the Active Citizenship Network, is together we stand for equitable vaccine action because vaccines work. Together we stand for equitable vaccine action because vaccines work.
We wanted to use FPA's vaccines work hashtag because obviously FPA has a massive following. It's a really successful campaign. So we're going to try to use some of their social media power to make our own campaign a little bit more effective as well. So that's where the vaccines work bit has come from. Is anybody nervous about filming? No, just be yourselves, natural. There's no, it's, you're never going to see us again, probably. Well, I hope you will. That's to be said. But you don't need to be embarrassed.
Absolutely. Very friendly bunch.
We also just want to get some headshots of you guys, so just a picture. So if we happen to make any social content that requires maybe a face to be next to the copy, we just like to use some of your actual faces, and because, as you said, you guys should be the face of it because it's your organization and your
vision. And very much we're aware that you guys are the experts in your markets and in your organizations. So we really just want to make sure that we are using and incorporating all of your great information. Are they nearly done next door? I might just go and check in on them.
I think no, we can go now for the last point from Bianca and Mariana and close the day, and you can continue to record in the other room, so we can just a minute that they would like to show you a video and we can go.
So I'll be very quick. I just want to make a short introduction about what we will discuss tomorrow. And so I will introduce you a European project, which is called Cooperator. So this is the program of tomorrow's meeting. And as you can see, after a brief introduction, we will have an informative session with two of the experts representing the consortium of this project. One from Cyprus and one from the Netherlands. They will connect remotely. And the first one is representing the University of Technology of Cyprus, which is the leader of the consortium of the European project. And then the other expert represents the Maastricht University. And he is the leader of one of the working package of the same project. And then at the end of tomorrow's session, there will be an advocacy session during which some of you will present some good practices, or at least some experiences for vaccination promotion in their own countries. So in a nutshell, Cooperator is a project developed under the U4Health project, which aims to develop a country observatory to share best practices for vaccination promotion, addressing vaccination hesitancy and implementing COVID-19 vaccination campaigns among healthcare providers and citizens. How the project aims to do so is by gathering and structuring and disseminating knowledge, best practices, and resources related to stakeholder strategies for COVID-19 vaccination and beyond. Three are the main target groups, which are citizens, health professionals, and local stakeholders. This is you. So at the moment, the project takes place in 5 different countries, which are Cyprus, Greece, Italy, the Netherlands, and Portugal. And it will end in October 2026. So the next steps, and some of them we partially discussed also today, are two different European workshops. More or less, the format will be the same as the one we used during these 2 days with you. And they will take place on the 14 and 15 October. So please save the date on your calendars. So the first workshop is about empowering and mobilizing patient advocacy groups on COVID-19 prevention and treatments. And so during that one, we will be discussing about the composition of the new European Parliament. And so we will look at the new champions on public health issues. Then we will be promoting European policy dialogue with the new MEPs, and we will draft also an open letter to the new institutions, which is something that Mariano already mentioned earlier. And then we will look on how to move from the European Year of Skills to the social media campaign on the need to prioritize upskilling of healthcare professionals in 2024. The second workshop, it will be on the vaccination informal platform for vaccination promotion. And so there will be an educational session on vaccine preventable respiratory diseases. And then we will also talk about the social media campaign. And so we will see the presentation, but also a dissemination plan. Also, there will be something about the European Flu Day, and then the presentation of the MEP interest group on, sorry for the typo, life course immunization. Of course, we would like you to be part of these activities. And see you tomorrow.
Thanks, Bianca. Just to recap, today there is a presentation of a EU-funded project, and we will understand why this project is relevant across Europe, not only in the 5 pilot countries. And then we have also some information according 2 days in this after the summer break, other 2 days in which we combine with some independent expert up-to-date information on vaccine preventable respiratory disease. The day number 1 only focus on COVID, prevention, vaccination, treatments. Day number 2, influenza, respiratory syncytial vaccine and pneumococcal vaccine. After this training with some expert, we talk about day number 1, political issues, how to advocate with the new member of the Parliament. So the composition of the member of the Parliament, are we in touch with some of them? How we can interact with them? Very pragmatic way. The second day will be focused on other aspects of our advocacy initiative, including the open letter to the institution, etc. In the middle, after this meeting and before the second meeting, you will receive a very brief qualitative survey. We will ask to you some aspect related with, in particular, COVID, and that will help us to realize the meeting in which we will talk about the COVID-19 in the day 1 of the meeting in October. Now, I have to show you in a few minutes some aspect linked with the adult immunization board. This is the last point of our very long program today. After my presentation and a 5-minute video, we take the picture together here, okay? Fine. Did you receive the link? Perfect. Okay. So just from my side, a few minutes to introduce a new initiative that is called Adult Immunization Board. The adult vaccination coverage in Europe and the barrier experienced during the implementation of the COVID-19 vaccination strategy in almost European countries and highlighted the need for a deep reflection about immunization programs in Europe. And starting with this reflection, two universities from here in Belgium, the Antwerp University, together with the University of Florence in Italy, joined forces to create an adult immunization board that is relies on years of experience with the multidisciplinary advisory board, the viral hepatitis prevention board created in 1992, and the HPV prevention and control board created in 2015. The purpose of this new board, adult immunization board, is contributing to the reduction of mortality and morbidity from vaccine preventable infection and diseases in Europe, in European adults, by providing evidence-based guidance on key technical and strategic issues, and by monitoring the progress of adult immunization program at the European country regional level. It's an independent international multidisciplinary group of more than 20 experts. I was invited to join this group representing the citizen perspective, but the board aims to provide scientific evidence. Is composed from academia, national health authorities, representatives from international organizations like WHO Europe that are invited to become members or join as observers. An unrestricted grant for transparency has been provided from Vaccine Europe that support the Secretariat. But of course, for the board and its advisors, strict operational and scientific independence is essential. Furthermore, adult immunization board advisors and invited experts get only travel subsistence reimbursed according to the university rules. No honorary or other form of remuneration are paid. We have a 5 minutes video that can start. Thank you. We can show some interview. This is Florence.
The reason why we created very recently the Adult Immunization Board with Paolo Bonanni from the University of Florence is that we realized that a lot of work has been done in Europe on infant and school children immunization programs, recommendations at the level of the national immunization technical advisory groups in the respective countries. But if we then look at the programs and the schedules for the adult immunization, we have to admit that quite often this has been treated stepmotherly, and a lot of room for improvement is there to target the adults, to know the burden of disease, of infectious diseases, vaccine preventable infectious diseases among adults, how to reach adults, how to lower the threshold, and how to guarantee a high coverage among adults. And we have to admit that there are not many structures in place to do the work and to obtain a very high coverage of the recommended adult immunizations in the adult population in Europe.
The Adult Immunization Boards is a group of experts representing their own specialty and their own expertise and their countries, and they give advice on the best practices and recommendations on adult immunization in Europe. The added value of this group is that we are trying to access also public health authorities and decision makers in order to make them understand the value of adult immunization. We know that vaccine preventable diseases today are much more widespread in the adult and elderly population than they are in children, where vaccination reached a very high coverage.
we organize 2 meetings a year. One meeting on the technical aspects of adult immunization. It can be on a specific risk group or on a specific vaccine, or how to improve the immunization on adults. And the second meeting in the second part of the year is a country meeting where we bring together key opinion leaders for the country with the experts from the Adult Immunization Board to discuss the way the country is addressing adult immunization. What are their barriers, their issues, but also their success stories? And in particular, what can we learn from the different countries in Europe? And that can be also used and implemented in other countries.
The Adult Immunization Board is a very good initiative, European initiative. You know that more and more vaccines are being developed to assess the quality or to improve the quality of life of adults. However, there's still a lot to learn from different countries. So the possibility of meeting with experts twice a year and discuss how to improve vaccine coverage, how to improve the delivery of vaccines to these persons, it is very important.
I believe that the approach of having first a technical meeting and the second a country-specific meeting would help a lot in developing strategies and helping countries to find the best approach in promoting vaccinations for older adults, in finding the strengths and the weaknesses across our countries, and try to make the best use in comparing data across European countries.
Thank you. This was just for information, but is probably one is enough.
So just because it's a new board, because I wasn't here for the first part. Is it an official or a voluntary organization?
Has been created by invitation by the two leading organizations, University of Antwerp and the University of Florence. And in the composition of the board, you find experts from different member states. So there are from different countries, many countries in the board. You can find it is 20.
The EU, the Commission.
No, they are not.
How weighty is their recommendations? Is it
Imagine that they are a very high level expert, excluding myself, but the rest are only very high level professor, academia, etc. And the activity is to collect information, data share. One of the main output, if you have this,
mandated by the
no, it's not mandated by the European institutions. As I say, that this was an initiative that take inspiration by other two already existing advisory board on two specific vaccination, HPV prevention, and the viral hepatitis prevention. That is a very long history, but is supported by Vaccine Europe. The people are on voluntary basis because they have accepted to join, are not economic support, but for them is an occasion, and for us is an occasion to be in touch each other. At very scientific level, the discussion, etc. And for instance, the next country meeting is planned in December in Finland, where the weather is fine in December. But that's it. I was in April in Czech Republic, and the next one is planned really in December. I hope to plan the next. No, after there will be in Greece.
No, in Greece also.
Sorry.
Between
in
July
May
or something,
2025 it will be in Greece.
Can I just ask a question, because it comes from, I think what you're trying to get at is, how do you measure success from such an august group, and I'm just wondering, from the point of view of this campaign, what is the measurement? What's the performance indicator to say this is successful? Because it can't be well, maybe it is, I don't know, that it's increased immunizations by 1% even, which would be a big figure overall. But like, what is the actual goal of this campaign? Does that make sense?
Yeah, it does. This thing is flashing green. I don't know why.
It means go.
Yeah.
Yeah.
Which is there you go.
I know, because there were two already
Ah,
switched
Okay,
on.
sorry.
I see. No, it's
Knock
fine.
it off.
You need it.
So it's a good question. I think in terms of social media campaigns, it's quite easy to measure those in the sense that they're trackable, there's metrics available. You can measure how many people have clicked on the post, have engaged with it, have liked it, have reposted it. So there's a wealth of data in that. And increasingly with some of those metrics tools on social media, you can break that down by demographic, by age, often sometimes even ethnicity on some platforms. LinkedIn is a good example of that. You can actually see the employment roles of the people that have engaged with the content. In terms of the bigger goals of the campaign from a policy perspective, I guess that's the thing that we kind of need to pin down.
That's what I'm trying to get at. Like,
yeah.
Like, it's fine everybody throws in and puts the head or shoulder to the wheel, but it's what is it that who is it that you're trying to influence in this? Is it the public? Is it policymakers? Is it the farmer industry? Who, do you know what I mean?
Yeah.
Who is it that we're trying to measure this? Because it seems to be quite a substantive exercise.
Yeah. And I think what we've always said and what works on social media is very singular things. One audience, one message, one call to action is always best practice for social media. It's what performs the best. The more you dilute messaging with many, many things, the less likely it is to reach people. So I think that's what we were trying to get through our discussion with you today, in terms of that's kind of why we asked the question, if you had one thing that a policymaker could change for you, what would that be? It may be that we focus on the public instead. I think that's something that over the next few weeks, when we have a proper creative idea in mind and kind of go through the process of that thinking, we'll come back to you with that. Yeah.
From every country, all of the different.
Yeah, exactly. So it's our job to find a message that can unite all of your thoughts under one thing.
And it's social media that you're doing the campaign.
Yes.
No.